was having a little glitch on the video, so I just updated my drivers. And we're looking good.
Yay.
So this is your very first day on a 1-800-GOT-JUNK truck team. I'm really excited. Of course you are. This is a great job. So tell me what you've learned.
Ready there? Ready there? Everywhere?
And what can you tell
Facebook,
We're on.
Instagram, YouTube, Twitch. Everything's on?
And you got it right.
I finally got it right. Garrett, it's funny because we do little promotions for these shows throughout the week. And I always I get those four, and sometimes I'll forget one, forget another. Garrett will be like, start over again. So I got them all right today. Facebook, YouTube, Instagram, Twitch. It happens when you're smart. And after about 30 tries, right? So today, good show. We'll be talking about hiatal hernias, acid reflux. What's really going on? I know I've brushed on it in the past here and there. We're actually going to give a whole concentrated show on just this topic because it's so important. And we call it the great mimic. Okay, heartburn or acid reflux can mimic so many other conditions. So a lot of you today are going to go, oh, I have that and I have the acid reflux. Now it makes sense. So this will be a very enlightening show for you today. So let me shut off the TV behind me. 14-mile-an-hour winds in Atlanta, 22 miles an hour winds in Gainesville. You work at a TV and radio station, you get news everywhere, weather everywhere. So, all right, we'll be starting up soon. Garrett's all by himself today, guys. So if you have any questions right now, send them in because Garrett's running everything by himself today. So if you have questions, send them in right now. Type them in. Garrett will try to get them to me at the break. If this is the first time you're watching, what we do is I do my live show, and then we go on breaks. And we have about 25 minutes every hour that we're on break where we talk to you guys very kind of casually, and I'll answer your specific questions. So any questions you have right now, type them in right now. Garrett will try to get to them. If we don't get to them, what you want to do is send them to me through my website, drjoe.com. I'll try to get to them for you as well. Okay, here we go.
Depend on it. Dr. Joe Esposito. Brought to you on WSB by Virtual Imaging.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Joe here. So glad you're there because we have a great show tonight, as we always do, actually. What we're going to be talking about today is hiatal hernias. Now, I know if you've listened to me before, I've discussed this topic in depth many times. We're going to go more in depth today because here's the thing with hiatal hernias, and I see this in my office every day, is it's the great mimicker. It mimics so many other conditions. And so many of you are having problems. You've been to all these other doctors, and I've had this checked, that checked. And when I go through the list, you're going to go, oh, my gosh, that's me. And you're going to go, oh, that makes perfect sense. Now it finally is making sense. And you're going to say, now I understand why the doctors can't find it because it's not the problem that they're looking for. It's actually a reaction to the hiatal hernia. Now, I'm going to open up the phone lines right away. Oh, DeMarco did it already. Good job, DeMarco. If you have any healthcare questions, the number here is 844-44-Dr.Joe, 844-44-DRJOE. And that number will bring you right through the studio. And if you have any questions, we'll try to answer them for you. Just the guys tonight. We got Garrett, we got DeMarco, we got Ahmad and me. So just the boys tonight, right? No girls here. And so any questions, bring them on in, and we'll see what get you there. So let's talk about this hiatal hernia thing because it's so important. And I believe it's the next big move in healthcare. And so far in the 35 years I've been in practice, whenever I make a prediction in healthcare, 100% of them have come true. So my prediction is this, that more and more people are starting to realize that they have the acid reflux, the heartburn, the burping, the gas, the bloating, and now they realize that there's something that can be done about it. So this will be the next big move. I predicted everything from margarine causing heart disease to I talked about stem cells. I talked about artificial sweetener causing you to gain weight. So many other things. Now we're going to talk about hiatal hernia. American Digestive Disease Society. A lot of you are probably members of that group, huh? Estimate that nearly half of all adults, some 60 million Americans, have a hiatal hernia. I think it's higher than that because we test for subtleties. We test for, in our offices, we have a way to test it even before it starts to show up. So I believe it's even higher than those numbers. It occurs more often in women than men. It affects all ages, but most prevalent in people over 50 and highly likely in people over 65. So if you have a problem, the older you are, the worse it is. And the reason is this. You have a sheet of muscle called the diaphragm. We're going to discuss this a little bit further. And it's a muscle. And in the diaphragm, you have a little hole called lower esophageal sphincter. And that sphincter gets weaker. Because as we get older, guess what? Our muscles get weaker. All the muscles do. Your heart, your lungs, your digestive system, your ileocecal valve. Everything gets weaker as we get older, and so you're more likely to have this problem. So the hiatal hernia can mimic so many other problems. A person with this problem can get such severe pain in their chest that they think they're having a heart attack. I've had many, many patients over the years come think they're having a heart attack, go to the doctors, they do all the tests, which is good. If you're having chest pain, absolutely positively get a medical workup on that. They come in, they say, Doc, everything was clear. I don't have the problem. And then we say, okay, what could it be? Check them for hiatal hernia. Sure enough, we fix it, chest pain goes away. So it's not uncommon. Now they think they have over acid production because acid is coming up, and that could be a problem because many times it's not too much stomach acid, it's too little stomach acid. And either one can cause the acid reflux and heartburn. So if you have heartburn or acid reflux, if you're producing too much stomach acid, which by the way is rare, that can cause acid to come up. If you're not producing enough stomach acid, the food can sit in your stomach and it can rot. And when it rots, it gives off lactic acid. So acids, aside from stomach acid, could be refluxing up into your throat because the food is not going from the stomach into the small intestine fast enough. And here's a little way to know that. You eat something, 4, 5, 6 hours later, you're burping, and you still taste that same food, chances are you have too little stomach acid, not too much. But there's things you can do about it, so don't worry about that. We got lots to cover here today. So many people think they might have an ulcer, could be an ulcer, but many times ulcers are caused by too little stomach acid. Because you have a bacteria in your stomach called Heliobacteria. And the Heliobacteria lives in the stomach, and we probably all have it. And when the acid gets too low, the bacteria isn't being kept in check, so it starts to multiply. And it can, as it starts to multiply, it can irritate the lining of the stomach wall and dig all the way down into the stomach muscle, and that could be the ulcer. So many times with ulcers, we can give you antibiotics to kill the bacteria, but then you kill off the other good bacteria as well, or many times we can raise the stomach acids up, and that solves the problem as well. So those are just little tricks you might want to consider, but you don't know what it is. You don't know if it's too little or too much. So let's get to the cause of the problem and not just jerk around treating the symptoms. Now, we also have to check the nerve supply to the stomach. The nerves in the upper back control the stomach and the esophagus. The lower neck controls the esophagus. So oftentimes I'll have people come to us after a car accident. Now, in a car accident, your body is locked in. The seatbelts hold your body in, but nothing holds your head in. So when you get in a car accident, even a minor car accident, your head snaps back and forth. And oftentimes, after an accident, people say, well, Doc, I started getting acid reflux or heartburn. What we need to do is check the nerve supply to the stomach. So the stomach could be pushed up into the diaphragm or kinked up into the diaphragm, or it could be the nerve supply to the stomach, or many times it's both. So I've said this so many times in my shows. If you're ever in a car accident, ever, if the car was damaged, you were damaged 100% of the time. So even if it's a minor injury, you got to get it checked. I always laugh at this. Insurance companies will say, well, it's minor injury to the car. It's only $500 worth of damage. What I want you to do, here's a little trick for all my lawyers and doctors listening and all my patients as well. Get the owner's manual. Read the owner's manual. Many times in the owner's manual, it's going to say any type of a collision, you need to replace all the seatbelts, all the safety restraints. And then guess what? That little $500 worth of damage is now a $3,000 damage. So always check your owner's manual if you're in a car accident to see what else needs to be repaired. Because the insurance company is going to tell you. You've got to take that aggressive step. And now suddenly you have a good case. Where the insurance company says, it's not a good case. It's not a lot of damage. Well, if the car didn't absorb the force of the impact, guess what? You did. So it's really important you get that checked. But that's a little trick for my doctors and lawyers listening as well, so that you can prove to the insurance company that the person was hurt. But go back to our hiatal hernia acid reflux stuff. The nerves in the upper back can control the stomach. So we need to get that stomach pulled down away from the diaphragm. So when you swallow, the food passes through your esophagus down into your stomach, and that hole in there is called the lower esophageal sphincter, and it opens, allows food to drop in, then it closes and prevents food from refluxing back up. So that got to go to break. Oh, so much to cover. This is a big show, folks. Got a lot to cover today. Folks, if you have any questions, I see folks are calling in already. The number here is 844-44-Dr.Joe. My website, over 1,000 hours of podcast there. We're going to talk about some supplements you can take for this as well, which I think everybody should be taking supplements. We're going to talk about super greens, essential source, digestive enzymes. All those are going to be on the website as well, drjoe.com. If you have any questions, you can send them to me through the website, drjoe.com. And I am Dr. Joe Esposito. Tell your friends about the show. We'll be right back.
How important the news.
High Samoro, High L and Samoro.
I don't know what that is.
I don't either. That's why I asked him, and that's what he was saying.
High L?
High L. Let me.
Hiatal hernia.
Is that what he was saying?
Maybe, is he saying hiatal hernia?
Let me just double check.
Yeah, change those words, because I don't know what that is. Yeah,
Yeah.
okay, good, thank you. Okay, hi folks, back to you guys now. So this is where we have our little intimate time where I'm on break here, and so I get to talk to you guys. And that was just DeMarco trying to figure out what somebody's question was. Now, do you have questions for me, Garrett?
I do.
Well, give me a
This is how this
question.
works, folks. I've got a question on Instagram. Is there anything from a chiropractic standpoint that can help a hernia in a male causing bulging or popped out belly button?
The answer is probably. The nerves in the low back control these muscles. Oh, lower that. There we go. Okay. Yes, the nerves in the low back control the muscles, and oftentimes there's something called the linea alba, which is the line in between your abdominal muscles, and you can get a hernia through there. So I've seen it happen, not every case, but some cases, where you adjust the low back, open up the nerve supply to that area, and the muscles tighten and solve the hernia problem. So it's certainly worth trying before the surgery, and you may need the surgery, but it's certainly worth trying. Mr. G, more stuff?
Yes. Is ice cream a good heartburn relief?
Well, it neutralizes some of the acids, because the calcium in there can neutralize the acids. But the answer is no, because it has sugar in it, which is not good for the bacteria in your colon. It has dairy, which is usually steroids, hormones, chemicals, pesticides, herbicides, tranquilizers, and the cows are fed genetically modified food. So I'm going to give you lots of foods that you can eat that'll act to calm it down. But ice cream it might work, but the negative effects far outweigh the positive effects. Poor Garrett's running like crazy today, guys.
And that's it so far.
Okay. He's amazing. I wish you could see. I'm going to put cameras behind me one day. Just watch Garrett run. He's like, oh, he's got all these computers set up, and it's just amazing.
Big news.
Uh-huh.
Well, we got some people coming from a network that may be putting us on TV.
I knew that.
on a
Oh,
new
they didn't
station.
know that.
They didn't know that.
Oh, it's big news for them, not big news for us. Okay. Okay, yes. Yeah, we have a big...
I'd worry if you didn't know that.
If I didn't know that, we'd all be worried. Did I mention that? Yes. So they should be coming this week. We're supposed to launch a TV show, either of this show, or I also do another show for 2 other stations, and we filmed that one. So 3 stations, actually, a TV station. So we're not sure which show they're going to take yet. They may take both. We don't know yet. So hopefully we'll know more end of the week.
Yeah,
Hopefully
by
next
this
week we'll have
coming
more
week.
information for you, yeah.
Yeah.
So it's a lot of fun. They may put cameras in this studio here, or they may put them upstairs where they have a TV station here, Channel 2, which just got bought out by another company now, so we're not even sure who owns us anymore. I don't even know. Yes. Okay. More questions? Come on, folks. Any questions?
Question for you, Dr. Joe.
I'm ready, man.
Vegan diet.
Yes.
I'm good on that diet, but still transitioning a lot of hygiene, cleaning, makeup, and etc.
Oh, yeah.
As a lady, any suggestions or recommendations on perfume alternatives?
Yes.
And any suggestions other than rose essential oil?
Well, rose essential oil is my favorite. But the essential oil is going to be the thing you want to do. And you can try all different essential oils and check what they do. Different essential oils do different things. Like Yang Yang, for example, is an aphrodisiac. Lavender will calm you down. I just like rose. And the reason is, I used to take dance lessons. You don't even know this story.
I don't.
What?
I don't know
You don't know this story. Years ago, I took ballroom dancing lessons. A bunch of my patients worked at one of the big ballroom dance studios. 1 minute. And they said, you got to come take dance lessons with us. And they'd take the lessons. On Tuesday night was open dance. So it was kind of like a prom night. And there was this one woman there, and she was much, much older. I mean, she was probably in her 80s, maybe even older. And she just dressed to the nines. And I just loved dancing with her. And I said to her one day, I said, I always love the way you smell. And she said, that young man is Tea Rose. And that's when I started liking rose colognes and perfumes. But I don't like the perfumes because they irritate my sinuses. But the essential oils work.
You know I hold a trophy for the Foxtrot and the Mamba.
I did not know that. You're really? I won a God, it was a Jethro Tull, the White Album. It wasn't Aqualung. I can't remember what it was. But I won that for a dance contest as well. So Garrett and I are both award-winning dancers. That was back in high school.
Same.
What was the name of that album? The White Album. If you remember, it was Jethro Tull. It was just a white color, white cover. Here we go.
Listen to Dr. Joe on News 95.5 and AM 750 WSB.
Hey folks, Dr. Joe here. So glad you're there. We're talking today about acid reflux and heartburn. And a lot of you jumping the gun. I'm going to get to a lot of your questions. Some folks are watching us live streaming on Facebook, Instagram, YouTube, Twitch. And so a lot of you have questions. I'm going to answer all the questions, I promise you. And we've got I want you to understand what it is, okay? And that's where we were right before the break. So you have this tube called the esophagus, and the lower esophageal sphincter is on the bottom of the tube where the diaphragm is. It opens up, drops food into your stomach. You digest food, and you pass it on. When the stomach gets pushed up against that hole, that lower esophageal sphincter, that's what can cause the acid reflux. We're going to talk about a lot of causes that may cause the acid reflux, because everyone who has this, and a lot of people do, the American Digestive Disease Society says 50% of people have it. I think it's more like 85%. And when patients come in, they say, well, doc, what caused it? So I'm going to go over a lot of the causes. Let's start taking some calls. The number here is 844-44 Dr. Joe. And Jack, how can we make your day better?
Yeah, I was just wondering what's the difference between the hernia you're talking about and the femoral hernia that I had surgery for about 10 years ago.
Moral hernia. Was that for the stomach?
I don't know. They told me I had some pains down in my lower groin area. They told me I had a femoral hernia.
Okay, yes, femoral hernia. Yeah, hiatal hernia is where the stomach pushes up through the diaphragm. Okay, the femoral or femoral hernia is down lower, and that's when a piece of the intestine can actually push through the abdominal muscles. So they're two very different types of hernias. Hernia just means it pushed through something. So they're two very different types of hernias, yeah. Mm-hmm.
Is that going to cause the same kind of symptoms?
Not really. If you have a femoral hernia, sometimes umbilical hernia, the small intestine is involved there, and the small intestine can herniate through a muscle. And the danger of that is if the muscle contracts around it, it can strangle that piece of colon, and if that happens, that piece of colon can die, and then it can burst in your insides, and it can be very serious. So, no, what you had is way down low. What I'm talking about is the stomach pushing internally up through the diaphragm. So,
all right.
Okay.
So my acid reflux is probably coming from something different.
The acid reflux is coming from what we're talking about today. Yes, the stomach is pushing up through the lower esophageal sphincter, and that's causing the acid to come up into the throat. Yeah, so that's our whole topic today. Absolutely right. So if you come see us, we're going to talk about how we adjust or pull the stomach down away from the diaphragm, and in most cases, we get amazing results. Okay?
Or change my diet.
Well, the diet's important, but if the problem's physical, the stomach pushing up against the diaphragm, changing the diet is good, but you have to physically move the stomach away from the diaphragm as well. So it's a two-point, yeah. Go ahead.
How do those occur because of your diet, or is that like a physical thing that can cause it to happen?
We're going to talk about that next, exactly. So keep listening. We're going to talk about all the causes that can be.
Okay. You're
Thanks,
wonderful.
Jack. Thanks, Jack.
Doc.
Appreciate the kind words. Thanks so much. Folks, if you have a healthcare question, 844-44 Dr. Joe. Philip, how can we make your day better?
Thank you. I wanted to know about partially hydrogenated oils and acid reflux disease and heartburn. So are partially hydrogenated oils the cause of heartburn and acid reflux disease?
No. The heartburn is caused by the stomach pushing up against the diaphragm. It's a physical condition. Now, if you don't have enough stomach acid, the food can rot in your colon. That can give, and then it can cause a gas or pressure that can push the stomach up as well, which we're going to talk about in just a second. The partially hydrogenated oils, you want to stay away from them. The problem is that if you have the digestive issues and if you have a gallbladder issue and the gallbladder isn't breaking down the fats properly, or the pancreas also helps break down fat, then you can get those sour burps. You can get that oily flavor in your stomach. But if we get the diet straightened out and fix the stomach, many times we take the stress off the pancreas and the gallbladder, and then a lot of that goes away. Because a lot of people, when they have these problems, they remove the gallbladder, and the problem doesn't go away. The problem wasn't the gallbladder, it was the stomach.
Yes, and another thing what are the foods to trigger the acid reflux disease and heartburn?
We're going to get there. Keep listening.
Those restaurants to be...
we're going to discuss those in just a few minutes, Philip, okay? So keep listening, okay? Thanks so much. Appreciate it. Yeah, everybody's excited. I know it's a good, hot topic here. If you have a question, 844-44 Dr. Joe, not just about stomachs, but anything. So, and any health issues, not just anything. So we talked about the sphincter, and a hiatal hernia occurs when the top of the stomach either rolls or slides up into that opening, and it becomes stuck up there. Now, I had this condition for years, and I had burping, and I had bad breath, and I was always bloated, and I could never figure out what it was. And I remember several years ago, I was in my second adjusting room in my office in Marietta, and I was just about to adjust a patient, and this light bulb went on in my head. And I went, that's what it is. And I grabbed one of my associates at the time, and I said, I want you to do this to my stomach. And I wanted him to pull my stomach down away from the diaphragm. And he did, and for the first time in my life, I had no stomach pain. I always had some pain or more pain, but I never had no pain. And I remember that day walking around going, this is really a weird feeling. and the bloating went away, and the stomach flattened out, and the breath cleared up, and it was really incredible. And so that's why in our offices, one of the questions all our doctors ask is, do you have any digestive issues? Because many times you may have the acid reflux or the hiatal hernia, and it's causing a lot of other problems. And we'll talk a little bit about that as we go on. So symptoms. When a part of the stomach is forced up through that sphincter, that opening, the stomach acid can travel up into the esophagus, and that can cause burning. It can cause esophageal spasms. It can cause inflammation. It can cause ulcers. And a lot of times people have chronic cough. They have sinus problems. The acid can come all the way up through your esophagus into your throat, which can irritate your vocal cords and a chronic cough. It can go all the way up into the sinuses, and that can be a problem too. And in a little bit, we're going to talk about how it can affect asthma. Because if that acid leaks down into the lungs, it can cause an inflammatory reaction in the lungs, and you can't get enough air. So this is the great mimicker, this the hiatal hernia things, and that's why you want to start looking into it. So if the stomach is pushing up against the esophagus, it can affect something called the vagus nerve. And if you've listened to my shows before, you know that's probably my favorite nerve, the vagus nerve. And when the vagus nerve is irritated, that controls the release of something called hydrochloric acid. Hydrochloric acid is the acid in your stomach that helps break down proteins. So you can overstimulate hydrochloric acid production or understimulate it. And if we understimulate it, you're not digesting your food properly. So this can affect the sphincter at the bottom of the stomach and the digestive secretion on the bottom of the stomach. We have the one at the top of the stomach. So if the vagus nerve isn't working, there's a sphincter that opens up on the bottom of the stomach, which lets the food pass from the stomach into the small intestine. And if that sphincter becomes weak because you're irritating the vagus nerve, you can leak partially digested food from the stomach into the small intestine. And when that happens, then your pancreas has to come in. You always think your pancreas only doing insulin. Your pancreas produces amylase, protease, and lipase, which break down proteins, carbohydrates, and fats. So if the food is passing from the stomach into the small intestine partially digested, the pancreas is your last hope. And it's going to start pumping out digestive enzymes to try to break the food down more efficiently. In most cases, the pancreas can't do the stomach's job, and then we start having some long-term serious problems. And many times you'll have food allergies. Now, because these undigested proteins pass into the small intestine and get absorbed. Now, in our office, we can do a food allergy, a sensitivity panel. We can do a lab test on you, and we can do saliva, or we can actually do a finger prick and test the blood and find out what your food sensitivities are. I strongly advise you get this done, because you want to pull the stomach down away from the stomach away from the diaphragm. But if your immune system is so sensitive to certain proteins, we can do those tests in our office. And when we do those tests, we can find out what specifically you have, get you away from those foods, and allow the immune system to try to reset itself, calm down a little bit. So if you want to get the food allergy testing done, you can go to our website, drjoe.com, and you can call the office, and Kayla or Tara actually will be the ones that help you with that. But we can get those tests done right in our office. We've got a bunch of other tests we'll talk about too. Hormone panels, male, female, bone panels, menopause panels. We can do a lot of testing in our office. Folks, got to go to break. If you have a healthcare question, give us a call, 844-44-Dr.Joe. My website, over 1,000 hours of podcasts. If you want to make an appointment to come see us for chiropractic care, for digestive issues, for nutrition, the website is drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We want to help you get well and stay well. We want to be your doctors. So, folks, the website, drjoe.com. Don't go anywhere. We're going to be right back.
You've been responding to Jamie.
Not sure why he played Miss You there. That was an interesting choice of music. Barrett's esophagus, radio frequency ablations. Okay, what can be done? Okay, another question coming in. What do you got for me?
Out of sync audio.
Uh-oh, out of sync audio. So I'm doing this. And doing your voices over here. It's like the old Godzilla movies, if you're old enough to remember those, right? We just got a new cord. Is it the cord?
It might be the cord.
Might be the cord.
Actually, I do. I think it's the cord. There was a little bit of static too, so I'm definitely going to trash this cord, but I got rid of the static by running it mono.
Okay.
Or at least I dimmed the static.
Dimmed the static, yes.
Let's see.
Okay. Questions? So we keep carrying, we keep running.
That's why I started wearing tennis shoes.
Yeah.
Can we purchase your supplements locally without having to pay the high shipping and handling?
Yes. Any of our websites, drjoe.com, Life Grocery in Marietta carries them, and hopefully we have a contact at Kroger. Hopefully Kroger may be carrying them soon too. And if you have any contacts in stores that want to carry it, let us know. Talk to Garrett and see what we can do for you.
And Mr. Thumper, if the shipping is showing up that high, give me a call and I can make some changes to that because it shouldn't be charging you per item. It should charge you one shipping.
Yeah, it's one shipping cost. So yeah, if there are any issues, folks, you're not sure, don't get upset. Call the office, talk to Garrett. He's more than happy to help you. He's very big on customer service, just like I am. So any questions you have, just call and we'll handle it.
Now, Dr. Joe,
That's
is
me.
apple cider vinegar good for acid reflux?
Yes.
I take Prilosec, and the doctor told me that it was not good for your bones. Or do you know of something else that would be better?
Raw organic apple. We're going to cover that. Everybody's jumping ahead. Everybody wants the quick fix. We're going to cover the foods to eat. Don't worry. I'll give you the tip. Dr. Joe's Digestive Enzymes. Go to the website, drjoe.com. They work amazing. Had a patient in 2 days ago, three days ago actually, and she came in. She goes, Doc, I get this horrible acid reflux. I'm getting my stomach adjusted. It's just not. It's better, but it's not healed yet. And I said, well, it's going to take time. She's probably in her 60s. This woman. I said, try Dr. Joe's Digestive Enzyme. She came in 2 days later, just all smiles. She goes, oh my God, that was a miracle, that stuff. So you got to help the digestive system work along. So the answer is Dr. Joe's Digestive Enzymes on the website, but we're going to cover that a little bit.
That's what I'm bringing home for Sierra this week.
Ah.
She just mentioned the same thing.
Uh-huh.
She was getting her stomach adjusted. After the first couple of times, she had a huge difference.
Right.
Like almost immediate.
Uh-huh.
And then following that, it was like less and less and less over time. And that's pretty much what I
Try digestive enzymes should solve the problem, yeah. And we do a food sensitivity panel on you as well at the office to find out if there's any foods that are triggering it.
Yes.
So.
And I think that's part of it because we've been eating a lot more peppers.
Uh-huh. That could be doing it.
Now, can CBD oil help with insomnia? Yes.
Yes. Garrett will answer that one for me.
CBD can help in some cases with insomnia. It can help relax you a bit. No more really than valerian root. And I would almost suggest for sleep, valerian over CBD.
But you got to fix the stomach because the stomach's
Yes.
job is to take proteins and break them into amino acids. And amino acid tryptophan combines with vitamin B6, creates a chemical called 5-HTP. 5-HTP becomes serotonin. Serotonin becomes melatonin. So taking melatonin, not a good idea long term, but fixing the stomach, most people they're amazed when you get the stomach fixed. So try the digestive enzymes first and come see us to fix your stomach if you have that problem.
And then in terms of CBD for heartburn, acid reflux, or anything like that, if it's inflammation based, sure.
Mm-hmm.
But that's just the...
Yeah, treating the symptom, not the cause. Yeah. Okay?
Can't cover it up forever.
Yeah, you got to fix it sooner or later, folks.
How do you feel about the keto diet?
Ah! Oh my gosh, we're 32 minutes into the show. We finally got to the keto diet. It's been a miracle.
This woman is doing it to lose weight and the belly fat to help with the indigestion.
Sure.
Not much relief yet after 2 weeks. I'm sure you're starting to feel kind of crappy, huh?
Yeah. You go through the keto flu sometimes where you start feeling really awful because your body is designed to use glucose as a fuel. Now, some people argue that ketones are more effective as a fuel. I'm not sure I'm buying that. Because otherwise we'd be naturally designed to eat a ketogenic diet. So I believe glucose is the primary fuel, ketones are the secondary. Now, if you're going to do the ketogenic diet, it's got to be short term, 2 months or no more, because studies are now showing that it can actually cause increased risk of heart disease. So the ketogenic diet is also impractical, I mean, to a point. I'm okay with it. I don't like the fact that you eat a lot of animal fats and animal products. I'm vegan. If you're new to the show, I haven't had an animal product in 32 years. But that being said, if you're going to do it short term to lose weight, I'm okay with it. Now, be careful with artificial sweeteners and even stevia, because sometimes some people, it takes them out of ketosis. Some people, they don't. And we have no way of knowing that. We haven't found a test yet to figure out if the artificial sweeteners are going to dump insulin or not. So if you're going to do it, please, if you're going to do animal products, please, I'm begging you, organic only. Dr. Joe's Super Greens, Dr. Joe's Essential Source, I feel have to be part of that program. The digestive enzymes would also be very beneficial for that program. But eating a lot of fruits and vegetables, nuts and seeds are ketogenic, and you're going to do very well with that. But I would stay away from the animal products just because of the other side effects. I don't want you to lose weight and get sick or worse.
Out of questions. So if you guys would, please share this, subscribe to our YouTube, follow us on Instagram and Facebook. And if you know what it is, check us out on Twitch as well. Make me look good.
That's right. Garrett twisted my arm and put us on Twitch, so you got to make him look good. And listen, by the way, share this information, and please, if you're on one social media, follow us on the other ones, Facebook, Instagram, YouTube. Subscribe to our YouTube channel. The reason is the more followers we have, the further we go up on the search engines, and we want to share this information, and you can help us. I can't do this. You have to do this. So this is your homework. You get the show for free, but your homework is get out there, like us, give us some Google ratings, a few stars maybe. I can't ask, just saying. But that'll help get the ratings up, and that'll get this information to more people. So we'd really appreciate it if you would do that with us. So.
And Candy, you were very welcome. Let's see if we get a question about black seed oil today.
Black seed oil, erectile dysfunction, and keto. We got the ketogenic.
We haven't gotten ED yet.
I know, we haven't gotten ED
It's been a
one
while.
yet. It's funny, a lot of you know us, so we get the same questions a lot, so that's why we joke. And we're more than happy to answer them. I'm not saying we won't answer them, but... Ahmad's looking at us. He's looking at the clock. Here we go.
Get DWSB. Depend on it.
Does this sound like... Shoulder pain, headaches? Chances are you'd benefit from chiropractic care. Most people benefit from chiropractic care because chiropractic care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-Dr.Joe and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well. Hey folks, Dr. Joe here. So glad you're there. Talking today about hiatal hernia. Boy, is this a hot topic. Holy cow. We live stream a lot of our shows on Facebook, Instagram, YouTube, and Twitch, and so we got a lot of folks sending in questions, a lot of people calling in with questions, and this is a hot topic because it's been said, you know, the powers that be say about 50% of people have hiatal hernia. I believe it's much higher than that because sometimes it's not showing up clearly on a test, but when we test it in our office, we do something called muscle testing. We can spot it early on. And so many people come in with allergies because they're not digesting their food properly and the proteins are getting into the small intestine, partially digested, and they get absorbed. And in our office, we can do a food allergy test. We can do a finger prick, or we can do a saliva test, and we can try to find out what you're allergic to so you can stay away from those foods to help calm you down a little bit. So I think that's really important that we do those tests. A lot of people, we said, as you get older, will have a more likelihood to have acid reflux and a hiatal hernia. So we can do a male hormone panel, and we can do a female hormone panel to determine your hormone levels, and then hopefully get those balanced as well. Because the hormone testosterone, for example, helps build muscle mass, and your diaphragm is a muscle, and your esophagus is a muscle. So if as your testosterone starts to drop, and it does as you get older, we can hopefully find out where the problems are, and then maybe naturally boost those testosterone levels to keep those muscles strong. So it's not just about fixing the chiropractic portion, which is huge. That's a major portion. But we also want to get the right food and supplements into you. So we can do a generic test on you. We can do a little deeper if you want to. We can get those tests done. And you can go to website drjoe.com. We have a list of all the tests we do there. And you can just call the office and get that set up. It's real simple. So we're talking today about the acid reflux. So the esophagus, if the stomach pushes up against the diaphragm, that prevents the diaphragm from moving up and down properly. As you breathe in, your diaphragm drops, and as you exhale, your diaphragm pushes air out. And if the stomach is pushed up against the diaphragm, it interferes with the movement. So people like that often have restricted breathing. They have shallow breathing, or they resort to chest or shoulder expansion to try to breathe. They're pulling their shoulders back and trying to breathe with their chest as opposed to letting the diaphragm drop. This is also what I find the #1 cause of sleep apnea. Been doing this for a long time, folks. I've treated a lot of people with stomach problems, thousands, I'd venture to say tens of thousands probably. And when you pull the stomach away from the diaphragm, I hear it every day. Patients come in and say, Doc, I'm not snoring anymore. Doc, I can sleep at night. Doc, I'm able to breathe again. Because you need oxygen. And if you're not breathing properly, the brain is not getting oxygen. Your brain controls everything. And your brain needs oxygen, stimulation, and nutrition. So if the stomach is up against the diaphragm, you may not be getting enough oxygen. You may not be getting enough nutrition because you're not absorbing your nutrients properly. Now the brain suffers. The brain controls what? Everything. So many times you'll have problems not understanding that the problem is actually coming from the brain. And that's where the new research in chiropractic neurology is just so cutting edge. It's blowing everybody away when we realize that as long as the brain is getting the messages to the body and the brain is getting what it needs, the body's able to heal. So it's really important you consider these things. And that's why so many patients come to us as patients because they want to get well. And I'm not saying don't get the tests done. I'm not saying don't take the medications that your other doctors gave you. But our goal is to try to get you well without the drugs and without the surgery. And if we can do that, that's great. And many times we co-manage your case with your other doctors, and we try to get you well that way. So the stomach up against the diaphragm causes the acid reflux, the hiatal hernia, but we need to pull the stomach down for many other reasons. We're going to give you a lot more reasons in just a second. Let's start taking calls again. 844-44 Dr. Joe. Billy, how can we make your day better?
Hey, Dr. Joe.
Hey there.
Listen, about a week and a half ago, my girlfriend got diagnosed with Barrett's esophagus.
Yes. Mm-hmm.
And she's also got a small hiatal hernia.
Sure. Mm-hmm.
And, we've just been kind of researching. She's kind of freaked out a little bit about it. There's no dysplasia.
Mm-hmm. Good.
At this point.
Excellent.
But are there any treatments? Matter of fact, she's got an appointment with your office about 2 weeks. But are there any? I've been reading about RFA. That radio
frequency ablation. Sure.
Yeah, that and even cryotherapy.
Sure. Well, until you pull. Until you pull the stomach away from the diaphragm, you're not going. I don't believe you're going to get all the results that you could be getting, because we have a lot of patients that have had the Barrett's esophagus surgery, the radio frequency ablation, and when they come see us, we pull the stomach away from the diaphragm, and they get the results that they're hoping for. Now, it can't help everybody, of course, but I would prefer to do it without the radio frequency ablation, because we're going to talk a little bit that after the surgery, many times you cut muscle and scar tissue, even with the radio frequency ablation, and the muscles are now weak. They don't heal properly. So it's a good idea to try conservative first and then go a little more aggressive if we need to.
Well, how do you pull the stomach away from the esophagus? Is it endoscopically?
No. We do it manually. We lay the person on their back. We take our hands. It's a manual technique, and we slide our hands over the ribs and then down, and we physically pull the stomach down away from the diaphragm. We essentially massage it. And I wish you could do it yourself, because I'd put it on my website and show you how to, because it would save me a lot of work. But you can't do it yourself. I've tried, because I have this condition too, and you can't fix it yourself, unfortunately. So.
Well, you have Barrett's?
I don't have Barrett's. I just had acid reflux. So I never got tested for Barrett's, so I don't know I don't think I have it. No. So.
Well, you know everything about supplements and everything. We've been out and got some DGL.
Right.
Licorice root. Is that?
Sure. That can help. Yeah, the licorice root might help, but what seems to work the best is Dr. Joe's digestive enzymes. And I can't tell you how many patients over the years we pull the stomach away from the diaphragm, get them on Dr. Joe's digestive enzymes, and they just think like they want to name their kids after you. Because, again, the supplements will help, but again, you have to physically fix the stomach as well, or else you're just treating the symptom, not the cause.
Okay.
So,
all right. Well,
bring her in. We'll check it. But in the meantime, you can get Super Greens Essential Source that have enzymes in it, and then Dr. Joe's digestive enzymes. Those three would be the package I would recommend for acid reflux. Okay.
And we can just pick that up at the office?
Absolutely. Save shipping if you come by our offices, Marietta, Duluth, and Stockbridge, or you can go to the website and we'll ship it to you.
All right, appreciate it.
Thanks, Billy. Look forward to seeing you soon. That's good. She's coming in. I'm happy to hear that. Okay, Ken, I'm going to get to you in a second. Let me get a few more things I have to cover here. So as the esophagus pushes up against the diaphragm, it can kink the throat, for lack of a better word, and that can actually irritate the thyroid gland and cause difficulty swallowing. How many people have difficulty swallowing? Raise your hands. A lot of you. They said, Doc, I swallow, it feels like it gets caught in the back of my throat, gets caught in the middle of my chest. That's what we're talking about today. When we pull the stomach away from the diaphragm, so often that works, and then we get them on Dr. Joe's Super Greens, Dr. Joe's Essential Source, which is the minimum amount of nutrients you should be taking every single day, regardless of whether you have this problem or not. That's the minimum amount of nutrients, and that allows the body to heal. You need nutrients to get the body to heal. And so many of you are nutrient deficient. And so no matter what we do, you're not going to get all the healing results that you could, because you're nutrient deficient. So Super Greens and Essential Source, minimum supplements everybody should be taking every single day. Then in cases like this, we add the Dr. Joe's digestive enzymes to it, and then we seem to get some really good results. And all those supplements are on my website, drjoe.com. And if you're having allergy reactions, many times we have to fix the stomach, and we can do the tests, the lab tests right in the office for you to test what your food sensitivities are. So you have to go to a break pretty soon, too. So the irritation, we talked about the vagus nerve, can cause reflex irritations throughout the body. The vagus nerve comes from the medulla, which is the back of the skull, and it controls, listen to this is important, your heart, your esophagus, your lungs, your stomach, your small intestine, your liver, your gallbladder, your pancreas, your colon. It can actually affect your kidneys, your bladder, and your external genitalia. So many people have romantic issues, and now that can even be linked to hiatal hernias. Folks, when we come back, a lot more to cover. If you have a healthcare question, the number here at the studio is 844-44-Dr.Joe. My website, if you want to make an appointment to come see us, and you need to. We have offices in Marietta, Duluth, and Stockbridge, drjoe.com. Hey, listen, do me a favor. Tell your friends about the show. Follow us on Facebook, Instagram, and YouTube, and we'll be right back. Does this sound like you? Neck pain, back pain, shoulder pain, headaches? Chances are you'd benefit from chiropractic care. Most people benefit from chiropractic care because chiropractic care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-Dr.Joe and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well.
Hey folks, it's Eric Erickson here. You guys know that I'm...
There we go. Oh my gosh, this is a hot topic, man. The phones are lighting up like crazy here. Has kidney failure. Can she take super greens? Yes. Okay, that's going to be my answer to Lisa.
So it looks like it's not a problem with the sound, it's a problem with the video.
Ah.
I just upped our video quality a little bit and it looks like it's lagging on us. But I think it has to do with us being on Wi-Fi. So I got to sit down and talk to somebody here about how I can hardwire.
Tim.
Yeah.
Yeah. Talk to Tim. He's nice. Yeah. We got connections here. What do you need? I know people. Rick's another one. Rick, actually talk to Rick better.
Rick, okay.
Yeah.
Rick's what else was I was going to talk to Tim about something else.
Yeah, there was something else I was going to talk to him. I can't remember. Yeah. Yeah. Ask Rick though. Rick likes us. Okay. I won't say his last name, but yeah, Rick is very happy with the results he's getting. So he's more than happy to help us out. He always says, "You need anything, you call me." Acid reflux has a hernia that pokes out in the center of his stomach. Okay, well that could be it. Okay.
So,
yes,
since we brought it up, speaking of ED,
yes,
are there foods that strengthen the muscles of reproductive organs, like protein, would in addition to other foods you've mentioned before that increase reproductive circulation?
You got to go to our website, drjoe.com, and it was 2 weeks ago or last week.
Asking for a friend.
Asking for a friend.
With the air.
That's Garrett being a wise guy. We did a show on the food romance connection, didn't we? 2 weeks ago.
Yes. So that was the addition. But really, last week you discussed circulation improvement, but not so much the muscle aspect itself.
Okay, that's testosterone. Testosterone is the thing that controls the muscles. So the adrenal glands produce testosterone, and so do the testicles. So as we get older, our testosterone levels drop. So I take Dr. Joe's adrenal support every single day. That's going to help the testosterone levels. Exercise is good. You want to stay away from animal products because animal products are loaded with estrogens, and estrogens counteract testosterone. So it's going to a plant-based diet. And in fact, who was it? Gosh, the guy who did Titanic. Who's the director who did Titanic? Can't think of it. Anyway. He just came out publicly and said that plant-based diet could pretty much wipe out the little blue pill industry. So yeah, if you go to a plant-based diet, you're putting a lot less estrogen into your body. The adrenal support is really vital to get the adrenals working. Adjustments, got to check the nerve supply and the low back because that controls the sex organs, and those things are going to build it up. You don't need more protein, please. You need less protein, not more.
And you don't know the full story of this yet, but I sat down with a chemist last week to talk about a men and women's formula for testosterone and estrogen.
Okay, there we go. So we're working on that. Mm-hmm. Yeah, so we're working on a supplement specifically for that.
Because what I understand is part of the problem is dumping estrogen.
Right.
And I guess as we age, we don't process out the estrogen as well.
Right, yeah, your testosterone breaks down to estrogen, so that's where something called diindole methane would come in. So cruciferous vegetables can help prevent testosterone from converting into estrogen. The adrenal support is going to help the adrenal glands produce pregnenolone, which becomes DHEA, which becomes your sex hormones. So yeah, there's a lot of things we can do for that, and most people are extremely happy when we get them working again, men and women. But you don't need more protein. You only need about 8% of your total caloric intake as protein. So if you're eating enough plant-based foods to maintain your weight and your energy levels, you're getting more than enough protein. Actually, more than enough.
Well, here's a nice surprise. So my hair's so beautiful since I've been on Dr. Joe's Essential Source and Super Greens.
Say that again louder, please. Someone's hair is so beautiful since they've been on Super Greens and Essential Source. Mm-hmm. Thank you for the compliment. Thank you for telling everyone else.
And I've noticed that in Sierra too.
Oh yeah,
her hair's gotten a lot brighter.
Yeah, it's great. I mean, it gives you a minimum amount of nutrients you need. I can't imagine why anyone wouldn't take Super Greens and Essential Source.
I had a guy come in. You got to meet him for a moment, but I had a guy come in who was spending $200 or $300 a month on like these 8 different products, all different brands. I won't mention any brands or knock anybody because they were good products, but the Essential Source cut out all 8.
Save a ton of money too.
It will go away. Getting well. Dr. Joe Esposito is on WSB.
Hey folks, Dr. Joe here. Glad you're with us today. We're talking about hiatal hernias, and boy, is this a hot topic. My gosh, we're lighting up on social media. We're lighting up on the phone calls here. And the reason is so many people have it. Now, as a chiropractor, my job is to help get you out of pain and get you well as quick as possible. And all my team of doctors are all trained by me. And here's the thing, they're my personal doctors. So these are the people that take care of me. And so I want to make sure that you're getting the best treatment possible. And so I don't let anyone treat you unless I know they're going to take care of me and I trust them. So that's why it's so important that you come see us so that we can get the treatment to get the nervous system working properly for neck pain, back pain, shoulder pain, numbness, tingling, muscle weakness. We get the digestive system working, which we're talking about today, and then we get you on good nutrition. And the minimum amount of nutrients you need every day is Dr. Joe's Super Greens and Dr. Joe's Essential Source. In the winter, you got to take vitamin D, folks. It's absolutely positively imperative. And I talked about vitamin D years ago, and this is another thing that's in the Dr. Joe was right column. We talked about vitamin D and how important it is. Now all the studies are coming out. It helps with brain function, immune system, and bone growth, and so many different things. You've got to get the vitamin D. All the supplements we talk about are on my website, drjoe.com. So we're talking about hiatal hernia today. And if you irritate the vagus nerve, I want to cover this again because we just went to break as I was covering it. If the vagus nerve is being irritated because the stomach is pushed up against the diaphragm, the vagus nerve controls the heart, the esophagus, the lungs, the stomach, the small intestines, the liver, the gallbladder, the pancreas, and the colon. It also has control over the kidneys, the bladder, and the external genitalia. So when you fix the stomach, so many things get better. This is why hiatal hernia is called the great mimicker. It mimics so many other conditions. And how many of you have been to the doctor, had all these tests done, and nothing was found? Can't find out what it is. Check the nervous system, check the hiatal hernia with the vagus nerve issues, and then get some good nutrition in your body, and a lot of those problems, in most cases, go away. Now, your stomach's job is to take proteins and break them into something called amino acids. Follow this. If I teach you nothing else in the years we spend together, remember this. Well, the nervous system controls everything. You need to get that fixed. That's the most important thing. Number two, proteins break into amino acid. The amino acid tryptophan becomes serotonin in your brain. Serotonin makes you happy. Many of you have emotional disorders, and we fix the stomach, and the emotional disorders get better. Serotonin becomes melatonin, which helps you what? Sleep. So many of you have acid reflux. You get sleep apnea from the physical aspect of the stomach pushing against the diaphragm, but you're also not producing the neurotransmitters that help you sleep. Tyrosine becomes dopamine. Dopamine gives you pleasure. How many people have just kind of, nothing really thrills me anymore? I remember when I was young, it was fun to do this, and this. Now, not so much. Could be digestive issues. A lot of you have chronic pain. Glutamine becomes GABA. GABA helps suppress pain. And you may take supplements, medicines, that have the word GABA in them to help suppress your pain, when in reality, we just got to fix the stomach. And then fix the pinched nerves as well, from a chiropractic standpoint. So stop suffering. My goal is to, every time we get together, my goal is to teach you ways to stop suffering needlessly. And the easiest thing to do is get the nervous system, digestive system, and your diet fixed. It's pretty amazing. Let's start taking some more calls here. Who's been holding the longest? Down here. Lisa, how can we make your day better?
Hey, Dr. Joe, how are you doing today?
Good, Lisa.
I have renal failure. Can I take the Super Greens and Essentials?
Yeah, I've never had anyone ever have a problem with that, yes. And with renal failure, you really got to be careful with taking heavy proteins. Because a lot of times diabetics can get renal failure, but a lot of times it's people just eating too much animal protein.
Yeah, so lay off the meat then.
Lay off the meat and the dairy, all the animal proteins. That takes a lot of stress off the kidneys. The Super Greens, the Essential Source work pretty well. And you can try the nitric oxide as well. Nitric oxide opens up your blood vessels, and that can help filter the blood through your kidneys a little easier, and that can take some of the stress off the kidneys too.
If I do that with it, reverse it, then I won't have it.
Well, I can't promise anything, but you're going in the right direction. Yes, ma'am.
Okay, thank you. Have a good night.
Thanks, Lisa. Appreciate it. Let's take some more callers. If you have a question, folks, 844-44 Dr. Joe. Ken, how can we make your day better?
Hey, good evening. I've got been told by the VA I've got a recti or whatever. It's not a hiatal hernia, but it's where my abdomen is separated.
Yeah, the linea alba, yes. Mm-hmm. Yes. Rectus, yeah, okay. Go ahead.
And they're sharing with me that that's probably causing some of my sleep apnea and also bad acid reflux.
Yep.
And I'm wondering, is there a way to correct that? Because they're saying there's nothing they can do about it.
Well, they're right. There's nothing they can do about it. Now, that doesn't mean it can't be fixed, though. Okay? So the answer is probably. I can't make a promise about that. But if we can take the stomach and pull it down away from the diaphragm, that may take the stress off the abdominal muscles so the linea alba isn't being stretched. And I've seen that resolve a lot of that in many cases when we fix the nerve supply to the abdominal muscles and then we pull the stomach away from the diaphragm. So the answer is maybe. Certainly worth a shot.
Okay.
Doesn't work, right?
Sounds great. Thank you.
Thanks, Ken. Yeah, folks, if you do want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. Just go to website drjoe.com or the number 844-44-Dr. Joe, which you call in with your questions when I'm on the air. That rings through to my offices when I'm not on the air. So we want to get you well and keep you well. We really do. Let's take another call. We'll get back to my show here. Brian, how can we make your day better?
Hey, thank you for taking my call.
You're welcome.
I'm a caregiver for my mom. She's got several issues. One is myasthenia gravis.
Oh, yeah.
She has been diagnosed with severe osteoporosis, and she has neuropathy.
Sure.
The problem is she's in constant pain, and she takes 420 oxycodone during the day.
Right.
And she's still in constant pain, and they're looking for the pain. They can't find it. So my question is, would your clinic be a service to her?
The answer is probably. We have one of our employees that has myasthenia gravis and gets very good results when we got her diet straightened out, we got her stomach fixed, and we got her on good nutrition. So we've seen a lot of folks with myasthenia gravis, and I'd certainly say let's do it. What do we got to lose? She's in miserable pain. She's taking drugs. It's not helping. Let's give it a shot. Yeah.
Miserable pain, and she sleeps like constantly through the day. She might get 4 or 5 hours that she's awake, and the rest of the time sleeping. So
my heart bleeds for this woman. Yeah, bring her in. Let's see what we can do for her.
I'll do that. Appreciate it.
Thanks, Brian. Appreciate it. And again, 844-44-Dr. Joe if you have questions, and that number rings through my offices if you want to make an appointment. So we talked about the acid coming up through the esophagus, and we talk about getting the stomach to work more efficiently. We have to physically pull it away from the diaphragm, but people always want to know, what can I do today? And that's where Dr. Joe's digestive enzymes, in many cases, helps tremendously because it helps facilitate the breaking down of the proteins into the amino acids, and then you can start to absorb the nutrients. Because if the food passes from the stomach into the small intestine, it putrefies in the intestines, and that causes greater toxicity. But here's the other thing. Here's the ironic twist. That can cause gas. And when you have gas, the gas can push the stomach further up into the diaphragm and into the esophagus. And so now you can't digest your food, which makes the food pass from the stomach into the small intestine partially digested, where it causes gas, which pushes the stomach up. Got it? So that's why the digestive enzymes can help, but physically pulling the stomach away from the diaphragm is usually the key. So we talked about food allergies, and we do testing in our office. We do food allergy sensitivity panels for you, so when you want to make an appointment, if you want to get that done, you can go to the website. We have it listed on the website what exactly it is, and we can get that done for you. But it can also cause constipation, anemia, immune issues, and even glandular system can be affected. Folks, I hear the music. I got to go to break. If you have a healthcare question, give us a call, 844-44-Dr. Joe, my website, drjoe.com. You can get the supplements there. We have over 1,000 hours of podcasts there. And folks, stop suffering needlessly. You, your friends, your family, and your children, bring them in to come see us. Let's see if you have something we think we can help. We'll get the nervous system, digestive system, and your diet straightened out. I'm Dr. Joe Esposito. Again, the website is drjoe.com. Hey, tell your friends about the show. Don't go anywhere. We're going to be right back.
Come to Shane Company, Atlanta's.
I saw you starting to rant.
Oh, thank you. I do that.
All right, so what about for postmenopausal women still suffering from symptoms like hot flashes, night sweats, and moodiness?
We have a wonderful panel we do called the postmenopausal panel, and we test your different estrogens, your estradiol, your estradiol, your progesterone, your testosterone, and then we can figure out where the imbalance is. So if you go to our website, drjoe.com, look under services, you'll see the studies that we can do. Let us do that panel on you, and let's find out what's going on so we can get it naturally balanced.
Now, can we do that out of state?
I think so. I don't know if we can. I don't know that we can't. So write yourself a note to check that. Mm-hmm. Okay. I don't see you writing.
I gotta find something to write on.
Here.
There we go.
Need a pen?
Yeah.
There. Throwing things at them. So, yeah, let's check with that. We'll check our labs and make sure we can do it out of state. I think we can. We've done. I don't know if we've ever done. I think we've done it in the past, but we'll find out. But the answer is probably yeah. Because I know a lot of you listen all around the world. You can't come see us as patients, but we can do these panels for you, and we can find out what's going on there. So.
And if we can't, we will find a way.
Yeah, we'll find a way. There's always answers for you.
Okay.
Garrett and I are people that want to get you well. Yes.
Dr. Joe,
That's
I've been
me.
having 3 headaches a day periodically. Dr. Amy found I have 2 vertebrae in my neck with arthritis, bone spurs, and very little gap in between.
hormone and food sensitivities required?
Wouldn't hurt. Let's find out if there's a chemical reason. We know there's a physical reason. Dr. Amy's one of our doctors, by the way, for those of you who don't know who Dr. Amy is. She's one of our doctors. She's awesome.
She actually takes care of me.
That's right. She takes care of Garrett there. So all my doctors take care of everybody, but we all kind of, usually we can't find, usually your schedule matches one of our other doctors. Our staff does anyway. Yeah, but the pinched nerves, of course, can be contributing to it, but let's find out if there's a chemical reason. Like, I can't do caffeine. I get a headache. So I know I can't do caffeine. So let's do panels on you and let's see what we find.
Yeah, for one, whenever he eats Asian food.
There's certain Asian foods that just give me a blazing headache, so it's monosodium glutamate. Yeah, the MSG.
And by the way, the guy that did Titanic is James Cameron.
James Cameron, thank you. Yes, James Cameron is the one who said plant-based diet will solve with the little blue pill business out of business. So.
And thank y'all for that, because he really will. He'll wake up at 2 o'clock in the morning and like it'll come to him. Just like sit up in bed like, James Cameron.
I love these things. These are sticky notes, and they are glue all the way across the back. So it's not just on the top, it's all the way across the back. And I love these things. And I have them in my bed, I have them in my car, I have them in my office, and everyone laughs at me. But you know what? I don't forget things with them. Don't make fun of my sticky notes.
Okay, another friend.
Yes, another friend. That's Garrett.
Was diagnosed this week with psychogenic polydipsia.
Okay.
Did I get that right?
I'll give you a bell for that one.
Are you familiar with this condition, and diet change can help manage and treat?
In most cases, yes. We got to pull the stomach away from the diaphragm. We get them on digestive enzymes, Super Green's essential source, get them off the animal products, which are very stimulating. Garrett's laughing.
Said get the bell ready.
Get the bell ready.
for that one.
Yeah, Garrett gets a bell whenever he says he pronounces a big word right, in case you're new to the show. So.
And this person's sinuses also get irritated because of acid reflux.
Called that one, didn't we?
Yep.
Yeah. Well, we usually call it right. Yeah. So pull the stomach away from the diaphragm. It helps the allergies. It helps the sinus issues. We get the body back to normal again. So.
What is the subject? Heartburn. Thank you for answering that.
There you go. Thank you for helping us out. Yes. Hiatal hernia and heartburn today. Man.
And that's it so far. But I do have a couple of rabbits that are watching. Misty's rabbits are watching.
Hi, Misty's rabbits.
They would like to know if you ate a salad today.
Yes, I did have a salad today, as a matter of fact. Thank you, rabbits. Yes. What was in my salad today? I had 3 different types of lettuce. I had sunflower seeds, nutritional yeast, and apple cider vinegar dressing in my salad today. I got to do my, these are liners I have to do for the show stations around the country, so bear with me for a second. I'm Dr. Joe Esposito, and this week we're talking about hiatal hernia, the great mimicker. A lot of you have conditions that you don't know are related to your hiatal hernia, and we're going to talk about what you need to do to get that fixed. Dr. Joe Esposito here. This week on my show, we're talking about hiatal hernias and acid reflux, and we're going to give you the things you need to know to deal with these conditions. Hey, we're talking about hiatal hernias and acid reflux and what you need to do to get these things fixed this week on the Dr. Joe Show. There we go.
And it's not quite there, but in a couple of minutes, Instagram is going to go down. Don't worry, we will be right back.
Yeah, Instagram does that to us.
And yes, we are going to find out whether or not we can do the food sensitivity test out of state. I'm sure it's fine. They send the blood test off to other states too.
Exactly. Yeah, I don't think it's a problem, but let's find that out. So what you want to do then is tomorrow send that question through the website drjoe.com. I will forward it on to Garrett, and then we're going to find that out for you. Okay.
And we'll get you answers directly, along with how much it is, what the time frame is like, and how to do it.
Yeah, because the food sensitive, we can do a saliva test. We just send it out to you, spit a lot. There you go. Garrett's throwing things in the trash here. It's not bad. Yeah, no.
So.
All right. What else we got?
What else did you eat today?
I did not have split pea soup today. Surprise, surprise, surprise.
You have not emailed Tina back, and she is looking for that recipe.
You know why? I just bought the stuff today. It's so funny you say that. I went to a store and I bought all the stuff. I don't have a recipe. I would just throw it in my crock pot. So I'm going to have to measure it for you now so I can figure that out. So I am on that. Yes. What did I have today? I woke up this morning. I had a grapefruit and some pineapple. Then I had Super Greens and Essential Source, of course. I had a salad. And then I went for a great hike. which was awesome. And there's a waterfall just east of my house there, and it's incredible waterfall. We had a lot of rain here in Georgia these past couple of weeks, and the waterfall was just crazy. So walked along the stream and everything like that. That was a lot of fun. And then I went to a Mexican restaurant, had some Mexican food actually. That was my dinner tonight. And that's all I had. I think that's all I had today.
I was at what's the restaurant? I can say it here, but South City Kitchen, and had some overnight oats. And had we'll be right back, Instagram. Overnight oats that had what are the black chia seeds?
Chia seeds, yes.
Coconut milk and pineapple with little bits of coconut. Like
interesting.
It was so good.
Was it great? Mm-hmm. There you go.
Of course, I was watching my dad scarf down chicken and waffles next to me, you know, with like 2 ramekins full of butter. I so wanted to just dive into that.
I went to a vegan restaurant last night out in the Decatur area, and the food is great, but the service was horrible. So I won't say their name on the air. But the food was good, but it was like a 2-hour event. So, but it was good. And a little expensive, too. For what you got, I think it was a little expensive. So. Okay. If you have questions, folks, send them on in. We have another hour here. So 25 minutes with you. What?
Oh, there's the
forecast. Overnight, clear and low around 35.
Yeah, we got 6 minutes after the hour. Right after the weather, then we come on. Traffic, weather, us.
Wednesday, mostly cloudy.
This is the 10-minute, I think.
What, the segment? Mm-hmm. They're all about 10 minutes, yeah.
Esposito. Brought to you on WSB by Virtual Imaging.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Personal responsibility and independence are important to you. Start today with something completely in your control, your health. Dr. Joe Esposito is on.
Hey folks, Dr. Joe here. So glad you're with us today. Talking about hiatal hernia. Obviously a very, very, very hot topic here. Tons of callers coming in. You want to follow us on Facebook, Instagram, YouTube, and Twitch because we do live stream a lot of our shows, and then you can see my pretty face if you want to. It's not really that impressive, but it's something to do. And then we can answer questions for that as well. And my website, of course, is the ultimate source of information, drjoe.com. Well over 1,000 hours of podcast there. We have a search bar. You can type in, search words that you're looking for. We have articles. We have radio shows. It's really great. And any questions, send them to me through the website, drjoe.com. So I'm going to get to your questions in a second. Brandy, Jerry, we're going to get to you guys in just a second. I want to talk about the causes of hiatal hernia because everybody says, what causes this thing? So hiatal hernia, each one is kind of unique, what we find. First of all, it can be mechanical causes, and that's what we talk about all the time. Improper lifting, hard coughing. Again, if you do bouts of heavy lifting, sharp blows to the abdomen, if you get kicked or punched in the stomach, that certainly can do it. Tight clothing, poor posture can contribute because you're hunched over, and that's causing the chest cavity to push up. Improper lifting is one of the big issues there. And if air is not being expelled out of the person's lungs while lifting, that can force the stomach up into the esophagus. So if you lift weights, if you lift boxes, if you lift children, exhale as you're lifting, okay? DeMarco, you gonna agree with that one? DeMarco's giving me a thumbs up. He's a personal trainer, so he's agreeing with me on that. So you have to be able to exhale as you're lifting anything. So be careful with that. But also, if you have a bad diet and you produce a lot of gas, the gas in the colon can push the stomach up against the diaphragm, which again, as we said earlier, you kind of get caught in a loop there. The bad digestion causes the gas, which causes the bad digestion, which causes the gas. So getting the diet straightened out will help. And that's where things like Dr. Joe's digestive enzymes many times are a lifesaver until you get the problem fixed. Dr. Joe's Super Greens, Dr. Joe's Essential Source are raw fruits and vegetables in a powder form. Then we had prebiotics, probiotics, digestive enzymes, and a complete multivitamin. And then the Super Greens are going to alkalize your system and help with the digestion. Probiotics are something else you might want to consider. And once again, years ago, probiotics it was nothing. Now we're prescribing probiotics for patients, and it's in the news. So this is another Dr. Joe was right. We talked about probiotics, 35 years ago. It's no big deal. Now suddenly, yes, probiotics are everywhere. you have to have probiotics in your colon. 70% of your immune system is in your digestive system. It's because of the probiotics. Pro meaning in favor of, biotic meaning life. It's in favor of life.
And you were telling me something the other day about fat people versus skinny people and the bacteria in their gut.
Yes, there's different bacteria in skinny people's colon versus fat people's colon. And so one of the reasons you might not be able to lose weight is the bacteria is wrong. So taking things like Dr. Joe's probiotics, eating a more plant-based diet that are going to feed the good bacteria in your colon, Super Green's an essential source with pre and probiotics, you can recolonize your colon with different types of bacteria. And so this is why I want you to get so important. You have to get the nervous system working, the digestive system working, and good nutrition. And good nutrition, good diet, and supplements on the website, drjoe.com. So anything could really be causing the hiatal hernia that's physical. Dietary causes, somebody asked about that earlier. It can also cause swelling of something called the ileocecal valve because everything's connected. From your mouth to your butt, everything is connected. And if you have an irritation of the ileocecal of the esophageal sphincter and the hiatal hernia, it can irritate something called the ileocecal valve. Now, the ileocecal valve is a valve that's found between your belly button and your right hip. So if you drew a line between your belly button and your right hip, if you have the opportunity, lay on your back because you want to relax those muscles and push pretty deep. And you're going to feel something that feels sort of like the tip of your nose, and it's about the size of a silver dollar. And when you push on it, if it's sore, chances are the ileocecal valve isn't working properly. And so the ileocecal valve closes and allows food, it's called chyme, which is digested food, from the stomach into the small intestine. It's kind of like a soupy mixture. And the chyme, when the valve is closed, backs up in the small intestine. Then the valve opens, and it's a sphincter. It opens and closes like we'll use your eye. How about that as a proper sphincter here? And it opens and allows the chyme to pass from your small intestine into your large intestine. Then the valve closes, and the water is absorbed, it's packed, and it's passed out of your body. That's a normal bowel function. If the valve is not opening properly and it's stuck closed, you can get constipation. If the valve is stuck open, you can get diarrhea. So many times we have to adjust the stomach, but we also have to adjust the ileocecal valve. And if you're laying on your back and you go between your belly button and your hip, you feel that tenderness, you can massage that area. And I want you to massage it in a clockwise motion about the size of a silver dollar. Don't go counterclockwise, clockwise. I'm going to take a few more callers. When I come back, I'm going to teach you some other techniques that you can do on your digestive system at home to try to make it work more efficiently. All right, let's take some more callers. Brandy, how can we make your day better?
Hi, I'm calling because my husband, who is 48, is a really healthy guy, but he just got diagnosed with a centimeter kidney stone.
Sure.
And we've been researching like what causes kidney stones, and apparently he's been eating all the healthy wrong things like spinach.
Right.
I don't know. That's what that's what we read. And
Sure.
then so we just have two questions really. What should his diet be to prevent this from happening again? And is there a way to naturally get rid of this kidney stone that he has, which is kind of big,
Sure.
without having surgery?
Sure. The answer is probably yes and yes. I always have to give you probably because not everybody, 100% of
Okay.
people respond. But you can cut out the spinach. That can be causing it somewhat. But going to a plant-based diet is going to alkalize your system. And many times with kidney stones and gallstones, you eat an acid diet, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Those acid foods have to be neutralized, and the body uses calcium as its primary neutralizing agent. So the body gives up calcium to neutralize these acids, and then it can build up. This calcium buildup can come as it passes out of your body through your bladder, through your kidneys first, or it goes from the liver to gallbladder into the small intestine. So going to a plant-based diet is very, very good for any type of stones, kidney stones, gallstones. Dr. Joe's Super Greens and Dr. Joe's Essential Source, very good to alkalize the system. And when you alkalize the system, the stones are less likely to form. The other thing, there is a product, I don't make it, it's called Stone Be Gone. Okay, I don't make it, I have no affiliation with the company at all, but I understand those are pretty good as well. So you can try that, just go on the internet and look it up. And then from a chiropractic standpoint, we would check the nerves in the upper part of his low back, and that's the nerve supply to the kidney. And we've had a lot of patients with kidney stones. We adjust that area, and it opens up the nerve to the kidneys, and the kidneys start to heal. So there's some things for you.
Okay, one quick question.
Sure.
How is he, because he does work out a lot, what's a healthy protein for him to have if he's not eating meat?
The body only needs 8% of its total caloric intake is protein. So carrot is 6%. So anything beyond 8%, unless you're an elite athlete, professional athlete, then you don't have to worry. Then anything beyond that is wasted. So he doesn't, going to a plant-based diet, he's going to get more than enough protein, I promise you.
Okay.
Okay?
All right. Thank you
Thanks,
so
Brandy.
much.
Folks, I'm Dr. Joe Esposito. Got to go to a break. If you have a healthcare question, the number here is 844-44-Dr. Joe. That number rings through to my offices when I'm not on the air. We have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. All the supplements we talked about are on the website, drjoe.com. If you have a question, call us right now, 844-44-Dr. Joe. We'll be right back. If you're like most people, you have neck pain, back pain, shoulder pain, numbness, tingling, headaches. Maybe it's time to stop suffering and it's time to take action. If you're sick and tired of being sick and tired, why don't you come see me and my team of doctors and let's see if you have a problem that we can help. Go to my website, drjoe.com, or call 844-44-Dr. Joe to make an appointment today because so many of you are out there suffering needlessly and we want to put a stop to that. Come see us at our offices in Marietta, Stockbridge, and Duluth. Make an appointment today so we can help get you well and keep you well.
Okay. It looks much better than that, but I have mine set down to 240.
Okay.
So that I'm not using extra data.
Okay, Banky. All right. So what do you got?
I have been taking pantoprazole.
Okay, I'm not sure if you're saying it right, but I don't know what it is. But go ahead. I can't give you a bell on that one. I'll give you one because you probably said it right.
Pantoprazole sodium delayed release for about 8 to 9 months. Is there an alternative? PANTOPRAZLOE.
Okay, what are we taking it for? The acid reflux?
I'm not sure.
Okay.
Brandon, if you'll let me know what you're taking that for, I'm also going to do a quick Google search.
Yeah, the OZLE usually is like a omeprazole and things like that, so I'm assuming it's for the acid reflux. So I'll let Garrett look that up. Yeah, anything that ends in the OZLE is usually for acid reflux. That's what we're talking about. So I'm just talking now so people don't think they lost sound. So
let's see.
Garrett.
Proton pump inhibitor.
There you go. PPI. Okay. Yeah, that's what I thought. Okay, we're going to talk about PPIs in just a second. The answer is yes. And if you just tuned in, we covered a lot of that on the show. This show is going to be on the website tomorrow, drjoe.com. But Dr. Joe's digestive enzymes, Dr. Joe's probiotics, super greens, and essential source many times solves that problem. The problem with the proton pump inhibitor is it prevents you from absorbing calcium, B12, iron, and magnesium, which can then lead to nutritional deficiencies. So that's my concern with that. Yeah, so there's your answer. So.
Question was, is there iron in the essential source? And there's not in the multivitamin,
right?
But there is in the greens blend.
Right. Well, it occurs naturally. Yeah, that's why. But it's a non-heme iron, which is much easier to absorb than the heme iron. The heme iron is absorbed easier, but the non-heme iron needs vitamin C to be absorbed, and the super greens, the essential source, have that in there. But what's the question? Just is there iron in it?
Is there iron in the essential source?
Yeah. Well, there is some because it's green. Yeah.
Which, by the way, the nutritional panel that has all the numbers and amounts, that's just a multivitamin.
Right. The other stuff is a proprietary blend, and so you can't list everything because you're using whole foods. And when you use whole foods, you can't get an exact number because it varies from batch to batch. So that's why you don't see it on there. So.
Which is also why sometimes it tastes a little bit different.
Yeah, some people say batch to batch is a little different because it's a whole food supplement, which is a good thing. We're not synthetically jumbling stuff together. So.
Now, I don't know if you can answer this, but your favorite restaurants in the Atlanta area?
I love Ethiopian food. It's my favorite. So it's a Guyan social club, I think it is, on Cheshire Bridge. I love that one. R. Thomas is one of my favorites. I like Roussan's. They got some vegan sushis up there, which I like that too. I don't go out that much, really. I like Indian food. Brazilian buffets sometimes are good if they don't put meat in the beans. But I don't go out that much. I like to cook at home. That's why you want to get this book, Eating Right for the Health of It, and it has over 200 recipes in it, and then you can make your own.
Hello from New York.
Hello from New York. What part? I'm from Hoboken. That's not New York, that's New Jersey. What's the matter for you?
So my daughter gets stomach pain with just about anything she eats.
Yes.
She no longer eats dairy or gluten.
Good.
Any suggestions that might be causing the pain?
Got to pull the stomach away from the diaphragm. Chances are it's spasmed. And we're going to talk about the emotional connection if we have time about that.
She also has a lot of allergies.
There you go. Break protein into amino acids so we don't get the big chunks of protein getting into the body. So we can do the food allergy sensitivity panel on her. And we can check her stomach as well. And chances are that'll solve the problem.
Now, is there a problem with having essential source and super greens with less than 8 ounces of water?
No.
But you should drink more than 8 ounces of water.
Yeah, you should, but I take it a little bit. I like things thick and creamy, so I'll mix it actually with less than that. So.
You're still experiencing some delays, and that fire under the overpass at the Beaufort Highway.
Yes, the pantrazole.
Yeah, right.
Acid reflux.
Yeah, I can tell by the suffix on it that's what it was. So. Here we go.
He would be the Brad Pitt of radio. That's why you listen to Dr. Joe Esposito on WSB.
Hey folks, Dr. Joe here. So glad you're with us today. Talking about hiatal hernias. Boy, is this a hot topic. Holy cow, the phones are lighting up. Social media is lighting up. So obviously this is a big topic, and I'm glad. And if you want to help get it fixed, we would love to be your doctors. We'd love to take a look at you and see if this is something we think we can help. And if you're just tuning in, many times we can take the stomach and pull it down away from the diaphragm, and then we check the nerve supply from the spine that goes to the stomach, and then we get you on a good diet, and in many, many cases that solves the problem. So let's talk about the correction, and Jerry and Jonathan, keep holding. If you have any questions, give us a call, 844-44-Dr. Joe. We got a lot to cover with this, and there's no way I'm going to cover everything we need to. So we talked about the ileocecal valve, which is a valve between your small and large intestine. It's the bottom right-hand side, of you, right above your hip on the right side. And it's hard to say which comes first, the chicken or the egg, because sometimes the ileocecal valve will swell up, and then it'll cause the hiatal hernia type thing. Or it could be the other way around, because they're very closely related, because they're all controlled by the same nervous system, the part of the nervous system called the vagus nerve, the parasympathetic nervous systems, which slow you down. So many times after we pull a stomach down on a patient, we have to check their ileocecal valve, and if we have to go in there, we'll just adjust the ileocecal valve as well. And when you do, it's pretty cool. Now, the ileocecal valve you can massage yourself, and I did promise you some tips you can do. So here I want you to do, lay on your back. Don't do it now if you're driving. Not a good idea. Lay on your back next time you have some quiet time, and I want you to poke around between your belly button and your right hip. Draw a line between the two, and that's where the ileocecal valve is. And just rub in a clockwise motion. If you hit a sore spot, just keep rubbing in a clockwise motion until the spasm starts to go away. Then I want you to work up your right side, from the ileocecal valve up to your ribs, and just little tiny circles, and see if you find a sore spot. And if you do, just rub it out. No big deal. Just relax it. Then from the ribs, you're going to go from the right side of the ribs to the left side of the ribs, rub across there, and see if you find any sore spots. And if you do, just rub it gently. Don't push too hard. And then from your ribs on your left side, kind of right below your breast, all the way down to your left hip, rub again. And just by doing that, when you're laying down, it'll help you go to sleep because it stimulates the parasympathetic nervous system, and the parasympathetic nervous system helps you sleep. It calms you down. Also, if you have any muscle spasms, just like you have a muscle spasm in your neck, you can rub it out yourself, which is kind of cool. So now you have some techniques that you can do to help get better. And I'm going to take a few callers, and I'll talk about some other ways we can help correct these issues. Jerry, how can we make your day better?
Hey, Dr. Joe, how are you?
I'm well. Glad you called.
Yes, sir. I'm a 49-year-old male. Suffering from a lot of different things. Sleep apnea, borderline diabetes, borderline hypertension. I got up to about 440 pounds. 3 months ago. I've went on the Atkins diet, and I've since lost about 70 pounds. Okay. There'll be times where I'm driving, and when I eat, I can't stay awake. I have to literally pull over and go to sleep.
Sure. Yeah. Well, they stimulate the parasympathetic nervous system. Sure. Mm-hmm.
And so my question really was, I've heard you talking about, repositioning the stomach, and I was just wondering what was involved in that. Is that a simple procedure, a complicated thing?
Well, it's like anything else. It's simple if you know how to do it, So, yeah, but I all my doctors are trained by me, and so they do as good or better a job than I do on it. But we take the stomach and we pull it down away from the diaphragm. It's really, I don't know, maybe the whole technique, once we get to that point, is maybe about 30, 45 seconds. We got to check the nerves in the upper back because that's the nerve that controls the stomach. So if any of you want to make appointments, come see us. You should. But
well,
folks,
I have lower back pain to the point where it interferes with my employment. I'm an electrician by trade, so I have to stand quite a long time during the day, and I can't stand for more than 10 minutes. I mean, the pain is excruciating.
Well, it sounds like you need to come see us, Jerry. I think that's going to be your answer. And we have an office in Duluth, which is not far from you. But if you call the office, 844-44 Dr. Joe, call during business hours. We'll set you up an appointment right away. I'd like to meet with you too. I like to meet my patients in the Marietta office, and then we can send them out to the other offices from there, if that's possible. Then we like to do it that way. And let's start getting you well, because
schedule an appointment in the morning.
Sounds like a plan, Jerry. Thanks so much. All right, my brother. We'll talk to you soon.
Thank
Thanks
you,
a lot.
Dr. Joe.
Bye. I love when we can help get people well. Jonathan, how can we make your day better?
Yes, sir. About 3 or 4 years ago, I went to the VA to get an MRI, check to see if I had an aneurysm or not, which I did not.
Good.
I'd had a couple relatives die from that. While I was in the army, when I got done, they said I had 2 degenerating discs in my neck. Said I had arthritis in my left shoulder, which goes up into my neck, and that's what was causing my headaches.
Sure.
And I was wondering if some chiropractic work would help that.
Oh, well, the reason you have degenerated discs, and this goes for not just you, Jonathan, but anybody who has osteoarthritis, bones rubbing up against each other, it's mechanical. The bones are out of place, rubbing up against each other. So and it's starting to happen now. A lot of my colleagues in the healthcare world are getting this, that if something's mechanical, the way to fix it is mechanically. Put the bones back in place. So the answer is a resounding probably. Yeah, I mean, if you have arthritis, you got to get those bones put back in place, because they're just going to continue to deteriorate. So, just that simple.
Yeah, because sometimes, like when I turn my head left and right, it sounds like 2 pieces of sandpaper rubbing together.
Yeah, that's not good, because every time you turn, it's getting worse and worse. And you and I aren't 16 anymore. We got to get these things fixed. So,
matter of fact, I just turned 57 this past Friday.
57, man. Jeez, you're just a baby. So, go to the website, drjoe.com, or the number you just dialed, 844-44 Dr. Joe, during regular business hours. We'll get you set up an appointment as soon as possible. How about that, Jonathan?
I greatly appreciate it, Doc.
Thanks, my friend. Look forward to seeing you soon. Yeah, and so many people are suffering needlessly, and I guess I'll go off on a tangent here. I'm going to talk about correcting the hiatal hernia a little bit more in depth. But if you have arthritis, it's because bones are out of place. If the tires on your car are out of alignment, what do? You put them back in alignment. So if you have bones out of place, put them back in alignment. I can't make it any simpler than that. It's not that complex. And this is where chiropractic care is just a godsend to millions and millions of people. And the biggest complaint I get, by far, is, you've listened to the show before, why didn't I do this sooner? Why did I suffer for so long? And my answer is always, I don't know. Because now you have the answer. There's no more excuses. You can't say, well, I didn't know any better. Now you know better. And every day, patients come in and say, Doc, I've been listening to you for 2 years, 5 years, 10 years, 20 years. My gosh, you're right on everything, Doc. I don't know what took me so long. And then we take an x-ray and we can say, wow, there's a lot of degeneration here. It would have been a lot less 20 years ago or 10 years ago or 5 years ago. So just get it fixed, folks. And mechanical problems need mechanical repairs. And since the hiatal hernia, which we're talking about, is primarily a mechanical problem, the easiest and best way to correct it is mechanically. And so many folks have surgeries done, and then they get scar tissue. And that can make the problem worse. Now, I'm not against surgery. I want to get you fixed any way we can before we get you to surgery. If we have to do surgery on you, it is what it is. But let's try to fix it naturally. We want to get the nervous system working, the digestive system working, and good nutrition. Folks, 2 more segments of the show. If you have any questions, give us a call, 844-44 Dr. Joe. My website, you can get the supplements there, make an appointment, listen to podcasts, send me questions. drjoe.com. What an amazing website. It's a lot of good information there. And we have offices in the Atlanta area, Marietta, Duluth, and Stockbridge, so there's no excuse why you shouldn't get well and stay well. I'm Dr. Joe Esposito. Hey, do me a favor. Follow us on Facebook and Instagram, and we'll be right back.
I like Aaron's.
There.
Where are we at on the show topic so far?
What do you mean?
What have you covered? What are you missing?
We got to do nutritional aids, some nutrition things and things that you can do. I'll talk a little bit more about the ileocecal valve, and I got a little bit more on the ileocecal valve, and then we can get into the medications if we have time.
Okay.
Heartburn medications and heart attacks. Okay. Is that okay? You approve?
Yeah. No. I
so
just want to make sure you get to the simple answers.
Okay. Got it. Yeah, we're going to cover that next, actually.
Okay.
Nutritional aids and the simple answers you can do. All right. What else? What do you got? What do you have? What do you have? What do you have?
What's going on, Nick?
Hi, Nick. I had an Uncle Nick. He's dead.
Apparently we need an office in Griffin.
Yeah, we need offices everywhere. What I'm doing, I'm trying to find doctors that I know can handle my offices. I want to make sure they're giving you quality care, and we're searching. I just did an interview with one Friday, as a matter of fact, and she was very promising. I don't know. She's torn between wanting to teach and practice, but she loves practicing and seeing patients, and so I'm hoping I can twist her arm a little bit. So
she can teach you.
Teach me. She can teach patients. She can come on a show and teach here. Exactly. So.
So outside of chiropractic care and diet,
yes.
Great question. What is your favorite field of medicine?
My favorite field of medicine? My goodness, neurology. Yeah, if I had to pick one, it'd be neurology. Yeah, because I tie a lot of that in with what we do here. So.
And because he's neurotic.
And I'm neurotic, yeah. Psychology, because I'm psycho. So. Any other questions?
Or Noonan, actually.
Noonan. Okay.
Noonan would be.
I got an offer to work at Cancer Treatment Centers of America. They begged me to come work, and I don't have the time. And there's a really good coffee shop called Leaf and Bean in Noonan. My friend Cher runs it, so go in there and tell her I said hi. And it's a really cool shop. It really is neat.
The real Cher?
Not the real Cher. Well, she's the real Cher, but not the Cher. But she's wonderful. Been a friend of mine for years. So, but she runs a Leaf and Bean.
Damon might lose it if you knew the real Cher.
I know. Our office manager's like in love with Cher, so I keep saying I gotta just go out, start treating her and bring her in one day. So. Yes.
Nothing else so far, which means you're doing a good job.
Okay, good. Covering everything. Excellent. Yeah.
Okay, so besides being an animal product, what are the pros and the cons of raw milk?
Raw milk has the enzymes available. If you take pasteurized milk and feed it to a baby cow, that cow will die in a few days to weeks because you're destroying the natural enzymes in there, and cows need those enzymes. So, again, I'm not a fan of it, but if you're going to drink milk, it needs to be raw. In Georgia, it is illegal for humans to consume raw milk, so I wouldn't recommend that. But if you're going to do animal products, I recommend, like I said, organic only, and for dairy products, I'd recommend raw. You're smiling. What are you smiling about?
I might have to start calling you Dr. Shepard from now on.
Dr. Shepard?
Who's Dr. Shepard?
Did I miss the joke? I missed a joke.
So is eating bean soup daily safe?
Sure. I take digestive enzymes with them. I think that's a good idea. See, we have a big window there, folks, going out to the studio, so everybody who's working tonight walks by and waves. So when you're wondering why I'm waving, I'm not waving at Garrett. So.
Okay, and now I've heard that lettuce has little to no nutritional value.
Uh-huh.
What do you have to say about that?
Well, it depends on the lettuce. Yeah. Iceberg lettuce, not a whole lot, but it still has some good things in it. And it's a heck of a lot better than a double beef cheese hamburger. So, yeah, it's okay. I mean, I'll eat iceberg lettuce every now and then. I like it. You know, it's not like I'm going to, not everything I eat has to be amazingly high in nutrients. So, but different types of lettuces have different nutrients. And in fact, romaine lettuce even has omega-3 fatty acids in it. How about that? So, ALA.
I didn't know that.
How about that? That's why you're here. I try to give you, every show, my goal is to teach Garrett and Ahmad and DeMarco something new that you had never heard before. And Ahmad's been with us for probably 10 years now, and he says every show he learns something new.
What were the question marks for? Upload, let me know what the question marks are for, and I'll get that out here. We got one more segment.
We got one more break, right? Two more segments, one more break, right?
But yeah, most all lettuce is going to be high in water.
Mm-hmm. Which is good.
Water.
Nothing else, it's high in water.
Grey's Anatomy, neuroscience. I should know that. Sierra just started watching Grey's Anatomy. And she's hooked.
I don't think I've ever seen it, actually. I have to say.
So do I need DHA supplements if I take Dr. Joe's Essential Source and Super Greens?
Probably not, but we are going to come out with aren't we? Mm-hmm. A algae-based DHA and EPA to make sure you're getting enough of it. So that's coming out soon. Yes.
And I did not realize that that's what you meant by, or that's what omegas?
Omegas, yeah.
Yeah, I didn't know that. So I made a funny. Made myself the funny.
Okay.
When I was talking about it, I said, well, I know we've covered the DHA, the EPA, the men's and the women's, and the vegan collagen.
Vegan collagen
that might be coming up here.
Maybe coming out soon. We're always looking for new supplements for you guys.
But what about the omegas? And she's like, those are.
Oh, you're talking to a chemist. DHA, EPA, and ALA are the omega-3 fatty acids, yes. That's what I call fatty acids, not fatty acid.
Dr. Joe told me to drink a gallon of milk and 2 Red Bulls every morning.
For those of you who don't know what we're talking about, I'm a guest on Eric Von Hessler's show every week. And as a comedian on his show, his name is Tim Andrews, and he does voices. He is such an amazing impersonator. and he impersonates my voice. So when we're on the show, Eric and I will be arguing back and forth because we always like to argue. And Tim will come on as anti-Dr. Joe and give advice like, drink more milk and make sure, it's drink your Red Bulls. It gives you energy. And so it really is funny when it all weaves together. We don't know when Tim's going to jump in. So we don't know what to expect. And he's hilarious. What a great guy. What a great show. The Von Hessler Doctrine, 9 to 12, every day, weekdays on WSB. So you need to tune into that. A lot of fun.
And if you're not around Dr. Joe enough, you really can't tell the difference between the two of them. So he jumps in just randomly, and you'd swear that it was Dr. Joe.
Yeah, no one here at the studio gets, first time he did it, he said something, and Pete, our boss, sticks his head in the studio and goes, "Did you just say that?" I said, no, it was Tim.
Okay, can your office help with sciatica?
Oh, yeah.
S-I-O-I-T-I-C-A?
Well, I'm going to give you the bell because it wasn't spelled correctly, but you said it correctly. So I'm going to give you the bell for that one. There you go.
I was worried.
S-C-I-A. Yes. Sciatica, it's a pinched nerve in the low back, usually the fifth lumbar. I suffered with it for years because I broke my back playing football and hockey and car accidents and street fights and stupid things I did when I was young. And chiropractic is the only thing that saved me. And we work on sciatic cases literally all day, every day. So, yeah. So the answer is probably yes. I can never make a promise, but the answer is probably yes. So. For you, your friends, and your family today, we have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well.
Yeah. Dr. Joe Esposito. United States of Health. Now on News 95.5 and AM 750 WSB.
Hey folks, Dr. Joe here. So glad you're with us. Boy, hot topic today. Talking about hiatal hernias, and my goodness, social media is lighting up and the phones are lighting up, and it's a hot topic. I said if I could never see another chiropractic patient again for the rest of my life, I can build multiple clinics on nothing but hiatal hernias and stomach issues because everybody's got it and nobody talks about it. And so it's really important that you fix it. So I want to cover some nutritional aids too. If we have time, we'll talk about some medicine, side effects, what you can expect if you take them. Again, I'm not against medicine. I'd just rather try to get it fixed without those medications. If you have a healthcare question, lines are open, 844-44-Dr. and that number rings through to my offices when I'm not on the air, because I know all of you are thinking, I need to go see Dr. Joe and his team of doctors, and the answer is you're probably right. So you can call 844-44-Dr. when I'm not on the air during business hours, and we'll get you an appointment set up as soon as possible. We accept most insurances, car accidents, sports injuries, Medicare. Yeah, we even accept Medicare. How about that? I think the last doctors in the world still take it. So, but we want to help you get well and stay well. And if you've ever been in a car accident, I got to say this. If you've ever been in a car accident, if a car was damaged, you were damaged 100% of the time. So make an appointment right away or as soon as you can right after your accident. And that's for you, your friends, and your family. Nutritional aids. Let's talk about some things you can do. We covered it kind of throughout the show today, but I want to get a little more in depth on that. If the problem, you need to correct it mechanically, but there are some therapies that can help. Immediate temporary relief for discomfort that you have, you might want to try something called slippery elm tea. Now, slippery elm tea, you can get it in a tea bag, and it's expensive. Or you can go to a good health food store, and they'll have it in a powder form. And that's the kind I use because I talk a lot. I talk a lot because I'm from Hoboken, and I talk like this here, and I talk a lot. And that puts a strain on my throat. So I do slippery elm tea just about every morning, and I do ginger tea every morning in the winter. And I take ginger and I grind it up. I get some organic ginger, peel it, put it in a food processor, cover it about halfway with lemon juice, and puree it. Puree the heck out of it. And then I take that and put it in an ice cube tray and freeze it. And so I take an ice cube of ginger every morning, put it in some hot water, sweeten it with some stevia, and I'll throw some slippery elm powder in there. And I had one of my coworkers, Monica Matthews, she says she's a patient of mine, so I can say this on the air. And she called me one day and asked her what to do, and I told her to take some of that. And she called me up. She goes, "Oh my God, it's like drinking snot." And I said, "Well, I think you put too much in there. You just need like a half a teaspoon." And that really helps soothe all the mucous membranes. So your throat, your stomach, your small intestine, your large intestine, very, very calming to the body. So slippery elm tea works really well. And also the herbs can help absorb some of the digestive secretions and the acids, and it prevent it from traveling back up into your esophagus. Comfrey tea can also work as well. But when you have these things, you want to get the digestive system working more efficiently. So that's where you want to get Dr. Joe's Super Greens, Dr. Joe's Essential Source, the digestive enzymes, and the probiotics. These are all designed to get the colon working more efficiently. And the Super Greens, the Essential Source, that's the minimum amount of nutrients you should be taking every day. I mean, everybody needs that. There's no question about that. So you can go to the website, drjoe.com, and you can get that ordered there. Or come by our offices and save shipping. Because I'd much rather have you save the money than pay the post office. So if you come by the offices, you can just pick them up there, which is really kind of cool. We talked about digestive enzymes already. You can try papaya and peppermint, chamomile tea. We talked about the ginger already. All these are very calming and soothing to the body. Celery can work very well. Celery is loaded with minerals, and minerals help neutralize some of the acids. So you can take celery every day. Spinach is very good for that, and figs. Now, if you've never had a fig, I have these huge fig trees in my backyard. My father took clippings from his father's tree, and I took clippings from my father's tree. And it's pretty amazing. And there's so many figs, I can't get to them. The birds, I have the healthiest birds and squirrels in the whole world, I think, because they get in there and eat my figs. But you can do figs as well. Try to do organic whenever it comes to anything, of course. Very, very calming to the body, the figs. They're loaded with nutrients. They're really good for you. So you might want to consider that as well. Dietary modifications can help relieve the pain and help it from recurring. Pressure from the abdomen and gas can push the stomach up against the diaphragm, so you want to avoid gassy food. So if you know a certain food is going to cause a lot of gas, you might want to avoid it, or if you are going to eat it, make sure you take Dr. Joe's digestive enzymes with it, which is kind of cool. You want to avoid overeating. This is such a big thing. If you eat too much food, the stomach is going to swell up and push up against the diaphragm. Now, I've done a lot of shows on digestion and weight loss. And remember, it takes 20 minutes to get the message from your stomach to your brain. Your stomach produces a hormone called leptin. Leptin is released into the blood, goes up into the hypothalamus in your brain, and that tells you that you're full. So when you're eating, if you're an overeater, like I used to be for years, you want to eat a little bit and then stop. Wait a few minutes, 10, 15 minutes, and then eat again. You're going to find you eat a whole lot less food. You're going to save a ton of money, too, by the way. So you want to consider that as a problem. Now, the other thing, too, is if the stomach is up against the diaphragm, I found this. I have no research except personal experience on this. If the stomach is up against the diaphragm, I can keep eating and eating and eating, and my stomach hurts, but I still want to keep eating. Anybody like that aside from me? Of course you are. So the stomach, I believe, and I have no proof on this research, that the stomach isn't getting the leptin up into the hypothalamus to tell me that I'm full. So even though my stomach is bursting, I want to keep eating. And so when I get my stomach adjusted, pull the stomach away from the diaphragm, many times that solves that problem. So a lot of people say when they get their hiatal hernia fixed, they lose a ton of weight because they're eating a lot less food. And so every overweight person I've ever known, I used to be fat, so I can say the F word on the radio. I used to be fat as a child, so every fat person I've ever run into, when we fix their stomach, it helps them eat more normally. And that's really, really important to get that fixed. But you want to avoid overeating. You don't want to eat a big meal after 3 o'clock in the afternoon, because you want to make sure the food is from your stomach into your small intestine before you go to bed, because when you're standing, you have gravity pulling the stomach down, helping with that hiatal hernia condition. When you lay down, gravity's taken out of the equation, the stomach pushes up against the diaphragm, and you have more acid reflux, which then can lead to acid irritation of the throat, which can cause chronic cough, which can wake you up, and also prevents the diaphragm from dropping down and moving properly, and that can cause the sleep apnea as well. And so many people have that sleep apnea. You fix their stomach, sleep apnea goes away. In fact, I was dealing with one of the directors of the sleep clinic at one of the major hospitals here, and she was actually here at the studio. And we talked about what we do, and we talked about the techniques we use, and she was blown away. She said, "How can we work with you? This is just incredible. We've never heard any of this before." And so it's really neat stuff that everyone in the medical world now is getting real excited about learning the things that we're teaching because they work. I'm not lying to you. This stuff really works. And again, I'm not against medicine. I'm not against surgery. I'm not against taking drugs if you have to. But let's try to get to the cause of the problem and not just treat the symptom. Now, I want to talk a little bit more about the ileocecal valve because it's so often overlooked. You got to check the nerves in the low back because the nerves in the low back control your back, hips, legs, knees, and ankles, but they also control your colon, sex organs, and bladder, including the ileocecal valve. So sometimes if people are having ileocecal problems, we adjust the low back and it opens up the nerve supply. I remember years ago I had a massage therapist named Bob, and he called me up one day on a weekend. He says, "I think I'm having an appendix attack. I'm dying. I'm in so much pain." So I went to his house, and I did something called soft tissue orthopedics. I actually started working on getting his ileocecal valve to calm down. His appendix was really hot, as we call it. So I put my hand on his ileocecal valve, my other hand on his trapezius muscle, and I was monitoring it. If he needed surgery, I had 911 on speed dial. I was ready to get him to the hospital immediately. But when I stimulated his trapezius muscle, that stimulated the spinal accessory nerve, would put him into parasympathetic mode. Parasympathetic nerves slow you down. Sympathetic nerves speed you up. And so by calming him down, and then I adjusted his low back, everything got better, which is cool. Now, not saying works for everybody, but it worked for him. Folks, I'm Dr. Joe Esposito. Got to go to a break. We have one more segment. If you have a question, we might get one or two in. The number's 844-44-Dr. Joe. My website, drjoe.com. Hey, tell your friends about the show. Don't go anywhere. We're going to be right back.
Does this sound like you? Neck pain, back pain, shoulder pain,
Did you get
headaches?
what I was saying?
Chances are you
I didn't have
benefit
time to
from
pick it up.
chiropractic care. Most people benefit from chiropractic care because chiropractic care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-Dr. Joe and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well. All right, last chance for you social media bugs.
There's quite a few people that think that you look pretty darn good in your new shirt.
Well, thank you. Thanks for noticing. I'm getting more custom fitted shirts. And in fact, I actually hired somebody as a fashion consultant. Because when I was on Dr. Oz show, one of you sent a message in and said, Dr. Joe, you were brilliant on Dr. Oz. Get some clothes that fit. So I took that to heart. And I actually got somebody. So we have 4, 6, 7 custom-made shirts coming in. One of my jackets just came in. I got to cut 2 custom-made blazers as well. So you'll be seeing those very shortly. So, but this is a off-the-rack fitted shirt. Slim fit, I may add.
I've never smelt.
You never smelled?
Never. You may want to try one of those adjustments.
Yeah, I could adjust the sinuses maybe, yeah. So
I've never felt smaller of a man in my life until I went shopping for more business clothes.
Right,
And I went to a store, I won't name which one, but I found out very quickly I am an extra slim small.
Nice.
It did not get any smaller than that.
You gotta love that, right? And I mean, you've got a good build on you. You don't look like extra slim small or anything, so yeah. All right, any questions?
How often do you get stomach adjustments?
I get mine checked every time I get adjusted. And I get adjusted about twice a week, once every 2 weeks, I'm sorry. I always get it checked. And there's a muscle test we do. And if it's up, we pull it back down and we're fine. So you're asking me, but how often do you need it? It depends. How old you are, if the muscles are weak. So we got to get the nerve supply from the spine to the stomach working and the stomach itself. So we got to do both.
So you're what, probably like once a month?
Once it's fixed, about once a month. But getting it fixed, it usually takes several visits right away. But believe me, it's worth it. Yeah.
I know I did it every single visit for about a month or 2 until it really stuck.
Yeah.
And then again, now it's just maintenance.
Just check it every now and then, yeah. So. South Carolina calling in, torn meniscus, options besides surgery. Yep. It's fun as the show gets bigger and bigger all around the country. It's kind of neat that, we get more and more people tuning in. So,
which is why we're trying to put together, since we syndicate all over the country, not only the radio show that you're listening to now and watching now, but the TV show.
Right.
So if you have a doctor in your area outside of Atlanta and Georgia, please refer them to us so that we can vet them. We're trying to put together a network of doctors all across the country, so that we can refer.
Yes.
Help them.
One of our doctors in Seattle is just like rocking it, man. He's like, thank you, thank you, thank you, thank you. Because the TV show airs in Seattle. So, and he just couldn't be happier, man. He's just getting pounded with new patients. So.
And he's a great doctor.
Yeah, he's a great guy. So, yeah, we do want to add new doctors to our referral list that we can, like I said, we got to vet them first, make sure they're good, and then we can trust them. So, okay.
That's so far.
That's it? The bunnies still watching?
Yeah.
Okay, the bunnies. Hi, bunnies. Hi, bunnies. So, how many bunnies do we have watching? I don't know.
2.
Oh, just 2 bunnies? Okay.
Let me remember what their names are. One is Coco.
Oh, Coco, okay. Very good bunny name, Bugs, of course, would be obvious,
It scrolled out.
Oh, man, darn it. So, nice to know we have bunnies as fans, too. That's nice. So, people, dogs. I know people watch with their dogs a lot.
So how can we refer doctors? Very easily, you can go to the website and go down to the bottom left, the little chat feature, and you can send us a doctor with some information, maybe the name of their practice, their actual name, or even their name and a phone number, or an email, however you'd like, and we will get in touch with them.
And if you are a doctor, I know a lot of doctors watch these shows and listen to these shows, send us your information. Maybe we can put you on our referral list.
See, I would like to set an appointment up with Dr. Joe.
Okay.
when you want to come in.
Tomorrow, next day, tomorrow we're busy. But,
so Marietta is where we would like you to come for your first visit so that you can meet this guy. He does like to meet a lot of his new patients. You can go to our website and you can set an appointment through the website. You can download the patient forms to save a little bit of time. But we're going on, so check the website and come see us.
Hey folks, Dr. Joe here. So glad you're with us today. Last segment of the show. Man, that goes quick. I know Rush Limbaugh says it's the fastest 3 hours in radio. I'm going to disagree with Rush. I think we have the fastest 2 hours in radio. So if you have any questions, we're really short now. So if you have questions, if I don't get to you, you can always go to my website, drjoe.com, and send them in there. I do want to talk about, we talked about hiatal hernia being the great mimicker. It mimics so many different things, shoulder pain and digestive issues, and it can affect your love life, and it can affect your liver, your spleen, your esophagus, everything. I want to talk about a little bit more about the ileocecal valve symptoms. The ileocecal valve, if you're just tuning in, is a valve between your small intestine and your large intestine. It's on the right-hand side above your hip. And if it's stuck open, you get diarrhea. If it's stuck closed, you get constipation. But here's some other issues, some symptoms that may show up that you never thought could be related to the ileocecal valve. Right shoulder pain, right pelvic pain, low back pain, pain surrounding the heart, flu-like symptoms, tinnitus. We've had a lot of patients with ringing in the ears. We adjust their stomach and their ileocecal valve, and the tinnitus goes away. Pretty cool. Everything's connected. Nausea, syncope, or like dizziness, headaches, bad breath. This is a biggie, folks. When you're around somebody and they've got that nasty potty-smelling breath, there's two things that give you bad breath usually, aside from just eating bad food. A rotten tooth, which has a certain smell to it, and if it smells like a toilet, chances are you have the ileocecal and/or the hiatal hernia issues, and you got to fix that, and then get on a good diet, get on digestive enzymes, super greens, essential source, Dr. Joe's digestive enzymes, probiotics, and fix the colon. That's really important. So bad breath is a symptom. It's telling you something's wrong. Face being pale, dark circles under the eyes, that can cause an inflammatory reaction, which puts stress on the adrenal glands, because the adrenal glands produce prostaglandins, which control inflammation, and so the bags under the eyes can be related to that as well. We talked about dizziness, bowel disturbances, diarrhea, constipation. If you're dehydrated, that can cause a lot of these problems. So, folks, you got to drink a lot of water. It's really important. Emotional upsets. Okay, think about this. The colloquialisms we use. She made me sick to my stomach. I got a bad feeling. I got a gut feeling about this one. Yeah, you experience a lot of emotions in your digestive system because you have as many neurons in your digestive system as you have in your brain. And the neurotransmitter serotonin, we talk about that a lot because that makes you happy. 95% of the serotonin in your body is not used in your brain. It's used in your digestive system. So emotional issues can affect how the digestive system works. How you eat. If you overeat, if you eat too quickly, you eat too frequently, you eat foods that you're sensitive to. That's why in our offices, we can do a food sensitivity panel. We can test you to see what foods you're sensitive to. We can do a male hormone panel. We can do a female hormone panel. We can do a bone health panel to find out where you are and what we need to do to get that corrected. Postmenopausal and perimenopausal, we can test that out and see if we can balance out the hormones that way as well. So all of those tests are on our website, drjoe.com. But you can call the office and we can get those for you. If you come in as a patient, great, but I know a lot of you, it's not possible for you to come in. So it's really important how you eat and what you eat. And you want to spread out your meals too. Because if you have a heavy meal, let's assume you have a steak, it takes about 6 hours to get from your stomach to your small intestine if the digestive system is working properly. If the food sits in your stomach for 4 hours and then you eat on top of that, the stomach doesn't know what to do. Does it pass on the partially digested steak or does it digest the food you just put in there? If you're eating simple carbohydrates and heavy proteins, the stomach doesn't know which one to digest first. So you got to be careful. You got to make sure your stomach is empty before you start putting more stuff on top of it. So spreading out your meals is really important. Let's go back to the callers. Where are we? Here we are. Doug, how can we make your day better?
Hey, Dr. Joe. Hey, I was calling. I've got a torn meniscus in my knee.
Yes.
And naturally want to cut it out.
Sure. It depends how torn it is. It depends how torn it is. Really, how we do. There's some certain supplements I might recommend for that. Ligaplex 2 is one of them. It's from a company called Standard Process, and they don't sell to the public, so don't try to go online and buy it. You can only sell to healthcare practitioners. And also, you got to put the knee back in place. When a meniscus tears, you got to put the knee back in place to take the stress off the meniscus. So I would check the nerve supply in the low back. I know you're probably not near me. You're in South Carolina. The nerves in the low back control the knee. The third lumbar specifically controls the knee. and then put the knee back in place, and then we can put together a nutritional protocol for you. And as long as it's not, it's not totally debilitating, I would try to fix it without the surgery.
Oh, okay. All right.
All right,
well,
Doc.
thanks a lot. I appreciate it.
Thank you. Yeah, and folks, if you have a nutrition, if you're not in the area, we can always do a nutritional consultation. We can do it on the internet, we can do it on Skype, or we can do it over the phone, and you can just book that on the website as well, drjoe.com, or just call the office. Now, it's interesting. A patient called the other day, and we were talking about chiropractic care, and she said, well, no, she was going to come to me several years ago, and then she decided she couldn't afford it. I said, come on, it's so inexpensive. So she decided not to. Eventually got so bad she went and had surgery. So the surgery didn't work. It worked somewhat, but she had to come back in and get further treatment with chiropractic care. And we were talking, and she said, Dr. Joe, I have to tell you, I was so wrong. I said, what were you wrong about? She said, I thought it's not very expensive. Believe me, folks, it's very inexpensive for chiropractic care. And she said, I realized after I had the surgery, I got a bill from the hospital for $18,000 as my copay. And I still didn't get all the results I want. She goes, so I want you to tell everyone, folks, don't cheap out. Get this thing fixed as quickly as possible. She says, because I wish if I could go back in time, I would have done everything you said, because now I regret not listening to you. So it's really silly not to get things fixed. So if you have a problem, if you have neck pain, back pain, shoulder pain, numbness, tingling, muscle weakness, headaches, come see us. Let's see if this is something we think we can help. We can't promise you results, but in most cases, we get extremely good results, and patients are very happy. Very few times patients aren't happy is because they didn't follow our advice. And that's pretty much a simple answer right there. So stop suffering needlessly, and not just for you, your friends, your family, and your children. We see a ton of children in our office. We had a patient come in the other day, 14 years old, horrible scoliosis. And I examined her, and I found the bones out of place. And then I checked something called the psoas muscle, P-S-O-A-S. And the psoas runs from your hip to your spine. It's your major hip flexor. It's a reason you can bend your leg up. And I said, every scoliosis patient I've ever seen in all the years I've been in practice, they have a psoas spasm. And I laid her down, I did a check on the psoas spasm, and sure enough, I showed her where the psoas was spasmed. And she sat up and she started to cry. And I got so touched. And I said, you okay? She goes, you're the first person to ever tell me that there's hope. And that's one of the things we do in our offices. We offer hope. We want to get the nervous system working. We want to get the digestive system working. We want to get your diet straightened out. We want to get you well as fast as possible, because the longer you wait, the older you get, the harder it is going to be to fix. And we accept most insurance companies. We have Medicare, car accidents. I've never seen a car accident ever where the car was damaged where the occupants weren't. So if you want to get well and stay well, go to my website, drjoe.com, or 844-44-Dr. And kids especially, what do kids do all day? They fall. You ever watch a baby? What do? They land on their butt. They land on their head. They bang their heads. And you go, oh my gosh, you okay? You okay? They might be okay at the moment, but chances are they might have thrown a bone out of place in their neck, and if the bones are out of place, they're going to grow crooked. So I really want you to stop suffering. And I'm not against drugs. I'm not against surgery. I work with a lot of doctors, surgeons, orthopedists, neurologists, urologists, psychiatrists, because finally the word is getting out that we can get to the cause of the problem and not just treat the symptoms. Folks, I'm Dr. Joe Esposito. Ran out of time. If you have any questions, go to my website, drjoe.com. Follow us on Facebook. Follow us on Instagram. Subscribe to my YouTube channel. We want to get the word out to as many people as we possibly can. And if I don't say it enough, thank you, guys. Without you, this show wouldn't be where we are today. So I'm Dr. Joe Esposito. Once again, the website, drjoe.com. Catch you next time.
Do you know where your mattress came from? If your mattress is from the original mattress factory, you can rest easy, knowing that your mattress was hand-built right here in Atlanta. And every original mattress factory mattress features American-made material.